So starting at 6:01 p.m. All right, we're going to talk about what was discussed in closed session. Well, I can't talk about what was discussed, but we did meet in closed session and no decisions were made. All right, I guess we need a flag salute. So if everyone could please rise. And Mr. Lear has the flag. Don't block it. Salute. Pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Ready? All right. Zipping through the agenda quickly here. All right. Do we have a motion to adopt the agenda?
So moved.
Thank you, Mrs. Anderson. Second?
I'll second.
Pardon. I did have a request to amend our agenda because there are some very specific topics that I'd like to talk about that are related to business item A. And without the information and discussion around those very specific topics, I'm not sure that I can make informed decisions. I'd like to hear about the status of the feedback received from CDHP on our CSP. I'd like to hear about the feedback from CSEA on our plan to transition to Plan 2 hybrid model. I'd also like for us to discuss learning community readiness, facility and supply readiness, and instructional plan readiness.
That all falls under the heading.
Yeah, all of those, first of all, the agenda can't be amended. Once it's posted publicly, that's it. It cannot be changed. We can move things from like the consent agenda out to be discussed individually, but we can't add anything to the agenda. But that's regardless, because all of this stuff falls under discussion for
Awesome.
Action item A. So once we get to action item A, we open it for discussion, or we open it for, we either get a motion to approve or a motion to discuss. And once that's done and we have a second, then we can discuss it and you can ask all the questions in the world that you want. I have a list myself, and I also know that Mr. Lear and everyone else, all the executives have presentations ready to hopefully address all those questions before we need to ask them. So we will be all informed before the end of this meeting. That's my hope anyway. All right, so we have a motion to adopt the agenda. Do we have a second? I believe Steve.
Mr. Bruno offered the second, I believe.
Great, thank you, Mr. Bruno. And general consent?
Yes.
Great. Okay, comments from the audience regarding items on the agenda. So what we're going to do is we're going to table this item number 8 until we get to business item A, where all of that discussion can happen. There's only one item on the agenda, so we don't need to have 2 comment sections. It's all going to be one conversation. So we'll put them all together. So moving on to business item number 9, excuse me, A, and that is the transition to Plan 2 hybrid model. The board is being asked to consider the proposed return to in-person reopening calendar for our schools as presented in the packet. Do we have a motion to approve or a motion to bring this to the floor?
I'll motion to bring it to the floor, Ms. Kelly.
Thank you, Mrs. Pope. Do we have a second?
I'll second.
And thank you, Mrs. Anderson. Let's let Superintendent Lear start us off.
All right, so thank you. So we do have a presentation, and Mr. Jordan has so graciously agreed to share it with you. While he's getting that going, we have 3 parts tonight that we're going to go through. I'll start with the line of the proposed dates. Then Mr. Grimes will go through the key components of the CSP, and then Mr. Jordan will provide us with a review of what Plan 2 looks like, because it's a plan that
I'm sorry. Can you back up and explain what CSP is, just for anyone that's listening?
Sure. So CSP is the COVID safety plan. That's a requirement for anyone to open. Actually, I think it's you have to have it for any opening that you do moving forward within that. So you would actually have to have that. There's different conditions based on the tier that you're in, but there is the requirement to have a CSP done before you reopen in any status. So, and then Mr. Jordan will finally review with you the plan, that reminder as a plan that we had adopted months ago related to the hybrid transition for 2. But one of the things I wanted to start with before I get to the dates is, I've been asked a couple times, why now? Why are we doing this right now? Well, one of the things that is the most constant with COVID, if anyone can be in our world right now, is change. Everything changes extremely rapidly. And so after our last meeting, the board had said, hey, go ahead and do 2 weeks into red, made that recommendation. Well, since that meeting, I'd shared with the board, we have received and been working with a company to increase not only our response testing at each school site, but also our surveillance testing for those individuals that would be volunteering to do that. The guidelines had changed a little bit with the update from CDPH. We have also seen that staff, which was a big one, has had the ability to receive vaccination. I thank wholeheartedly our Natomas partners and our Twin Rivers partners for making it accessible to a district of ours, because we had a lot of opportunity that all of our staff was able to do. And now with the county's offerings, and McClellan Park has one, all of our staff have had the ability to choose to get the vaccine or not if they so chose. The other thing is, we're ready. We want to make sure that the board has the ability to make the determination when you are ready to have us come back. We are proposing these dates tonight. We feel like we are ready, and we put these dates out to you and our community as a place to get back for our students in a safe, responsible way. We've put a lot of time and energy into planning. I will tell you, is planning, if you've been in education, I think planning, there's always things that happen that you're not sure of, but we know we have the big strokes. There's going to be little tweaks, I'm sure. And one thing we have in this great district is the ability to be adaptive and flexible, and we will make it right for our families, our students, and for our staff. So framing that, Mike, I'm sorry, I went a little longer, but do you mind pulling up just the first? I wanted to just go over with the board for clarity what we are asking you to consider tonight. So if we go to the first slide, Mr. Jordan.
Can you see it now?
Yes, we're good. If you'd go to the first slide.
Okay, sorry.
Or second slide, I guess, I'm sorry. There we go. So just an overview, what we are proposing is all staff would return on-site working, even in the purple tier, beginning March 22nd. A lot of our staff, our CSEA staff, has already been back working, but this we would bring all our staff back to the work sites to continue with their roles within the school site instead of in a virtual. They could do it on school site instead of from their homes or wherever. Then we're proposing March 25th. These are initial days. This is one day that the students in these grade levels would come back. I'm going to share why in a second. March 25th, all 4th through 6th grade would come back for in-person, even if purple. On March 26th, all TK 3rd grade would come back in person, even if we're in purple. And the reason you might think, why is that flipped off? Why not TK and 3 on the 26th and then the 25th and then the 26th for the older kids? One of the things we wanted to look at is we figured 4th through 6th, since we're only doing one day each, those students might be a little more flexible and independent than the younger. So if we have one day to even kind of run through our systems, we can even improve for the next day. Also on that March 25th and 26th, if we're in the red tier, because I must emphasize 7-12 right now, unless you're in the red tier, cannot come back to campus. So if they are not in the red tier, they cannot come back. But if we are in the red tier, our 7th and 8th graders would come back, and they were doing 2 days because that would take them through one full cycle of their schools. So the Thursday would be periods 1 through 3. The next day would be periods 4 through 6 for those that are choosing to come to the hybrid in-person model. I want to stress, and you will hear us stress, all families, all students have the ability to remain in 100% distance learning model that is fine. They can opt for that. And then we would then go on our week spring break, which if we determine from those 2 days that we've identified some areas that we need to improve, that gives us another week to actually come in and dial things back in for the full rollout, which we're proposing would be April 6th, because our spring break does go through April 5th. Ms. Anderson?
How many classes do we have that are reporting to class now?
We don't have classes. The cohorts can be brought back based on some different categories. Our homeless, foster youth, EL, and special ed students. I believe if not every site, most sites have cohorts coming or planning to come back.
Some are back though, right?
Correct.
Do we
And
know
that
how
was
many?
Excuse me?
Do we know how many?
I don't off the top of my head because we've added more recently, so I wouldn't want to misspeak.
Okay.
Mr. Jordan,
Thank
do you
you.
like next slide, Mr. Jordan?
I'm raising my hand because
I'm sorry.
I do have a question.
Thank you.
I have a question about what you mentioned about the options. I just think that as a district, we really do have an opportunity to make a reopening plan that meets the needs of our students and family, our staff and our teachers in ways that other larger districts may not. And what I noticed, because I also have students who are enrolled in this district, I haven't heard from a survey effort from this district since September or October of 2020. Our students and our families and our teachers and our staff have shown incredible grace to us as a board and a district throughout this time. And I want to honor and reciprocate that by hearing about and learning about what are their needs at this time. So before reopening, every school district locally that I've looked at has put out surveys about the return to school for their students. And some, like Natomas, have also surveyed their staff for their needs and preferences. So I'm curious about that. I'm curious about why we haven't yet launched a survey. Most of these surveys run for 2 weeks. They're heavily publicized and promoted by their districts. I'm just curious about why we haven't surveyed our families since September, October, and we're expecting that they're going to go back through their emails and update their preferences on that old survey. And I also think we need to survey our teaching and classified staffs. And I'm curious to know, what are our human resources reports for our staff who are at higher risk for severe illness or who have documented health concerns? What options are we providing to them? Are we surveying them? Are we seeing what their needs are? I think it's critical that we identify and support the staff who might be at higher risk for COVID exposure, that we provide them with options. And if we haven't done this survey of families to see what their preferences are for returning this spring, and to see what are their learning loss needs, then how are we acting in an informed way, in a database way in this effort?
And I think I'll cover 3 of those, Dr. Lee. The first one is the survey, you're correct. Our educational model that we would come back and plan to, we have continually put that out to people. I agree with you. I've almost sent that playbook in every email I've sent, probably in last. Now, am I thinking everyone's opening up and reading it? Maybe not. If the board chooses to do this, what our determination was, we would do a blitz campaign with people to say, here is the plan. Here's what plan 2 looks like. Please, and I've actually asked and reached out to a lot of districts too. Most are sticking with the plans, the educational plans that they had created. And then they're asking families, please go in. Some can use their student information systems. We absolutely will do that. We're not going to say, oh, you picked this, find your old survey, update it. We will 100% reach out to our community and say, tell us what you want. In fact, and you and I might have talked about this last week, I had put out in a message, you guys, you'll have an opportunity to select. We had multiple school sites say, hey, Scott, people have called the school and started to switch. So we are 100% behind informing people. Once we get the dates, we will continue to blitz that for them to do that. Other than the program, we haven't heard feedback to adjust that in any way. So the months that we put into that would certainly delay any opening. Now, if we get back into it and we need to make adaptions, again, the benefits of a small district, we can make adaptions pretty darn quick. Surveying of the teachers, Ms. Mason is on. I know that she did survey the staff about coming back. And I'll probably misspeak, but I believe about 17% of those surveyed, and I think there's 220 teachers, 17% said they couldn't live with this plan. I don't believe they gave reasons why. It was kind of a yes or no. But also CSEA, we haven't surveyed because most of those people, most of our CSEA workers are already back. We have about 2/3 that are currently working. And the final point you brought up is actually 100% another concern of ours, which we've addressed in any agreement with our teachers, is most of the medical accommodations as we prepared before to come back, Mr. Grimes met one-on-one and consulted with them through any medical accommodations. Absolutely. We would ask that people refresh. A lot of our medical exemptions came from a place of no vaccine being provided. We've already had multiple people who had accommodation plans have said, we can go ahead and pull that, Mr. Grimes, because I've now received the vaccine and will receive the vaccine. That's another key component of this plan is a bulk of our teachers were vaccinated last week. They will, before they come back in this model, would have the second dose, if they so choose, and also a week or two of time after that second dose. So they would be, I mean, knock on wood, as protected as they could be. But an ability we are and will be reaching out to our employees to say, what accommodation you need. Today, we had a person reach out wanting some more plexiglass. Mr. Deason is already like, yep, I'm on it. So I think you have 3 points. I make sure I covered those at least for you before I move along.
Yes, and on this slide, I do have feedback about this, the dates that are here.
Yes.
As I look at the metrics coming out of Sacramento County, we are still in purple tier with 12 cases per day right now. We have positivity rate of 4.7 and a 6.6 health equity metric rate. The testing and surveillance measures for our communities of color and low-income communities remain lagging and questionable. So the actual county metrics may even be higher. I really think that we don't have a crystal ball that tells us that the metrics will be good to go by March 22nd or April 6th. It looks promising, but we just don't know. And if we've learned anything through this pandemic, I hope it's that we should refrain from predicting dates. In January, this board came together and we agreed to use red tier as the marker for our return to face-to-face instruction. We're not in the red tier today. And so I think it's a really dangerous prospect for us to be considering dates. It looks like it might happen. Numbers are charting downward. But even if those healthy equity quartile rates remain high in Sac County, and this is confirmation about the students that we serve. 60% of our students in our district are people of color. 65% of the students in this district are low-income community members. They are being disproportionately affected by this virus. And that's why I'm concerned about this rush back into in-person instruction, even in the red tier, when the community cases remain very high and the health equity metrics remain at unacceptable levels. It's concerning to me. I think it's something that we need to take great caution with. Our low-income students and our students of color, who are the majority of students in this district who we serve, are at higher risk of exposure to and death from this virus and the emergent variants. And really, it's, are we in an ideal situation? No, but at the same time, I value the lives of students and communities we serve enough not to want to rush back to in-person instruction without the facilities and supplies we need, without awareness of the needs and preferences for students, teaching and classified staff, and without clarity about the logistics of our hybrid 2 learning plan, which has actually changed significantly since last year. I've downloaded hard copies of all of the documents, and they have changed and been updated. So we're not talking about the same plan we made months ago. We truly are not.
Dr. Lee, do you think we don't care about the students? Is that what you're trying to say? Because they're of color? I think you got a lot to learn about Center School District.
Nancy,
okay,
I said a statement about me, not about our board. So please,
for number one,
so please lower your tone.
COVID.
Okay,
lower
guys.
your tone.
Over and over again. Number two,
your tone's inappropriate, Miss Anderson.
We're talking about red tier because everybody is getting the vaccine. We're not rushing
There's-
into it
there's
or
questions
changing
about-
it. It's
there's
because the
questions
vaccine
about
is
that.
now available.
Excuse me,
There's questions about that.
excuse me. Okay. I understand that this is a really volatile subject and there's a lot of passion and there's a lot of concern. I would just ask that, first of all, we all care about the kids. We all care about the lower income, the socioeconomic, the races and ethnicities. We care about all of that. And just as an FYI, the reason that the blueprint for the state of California is changing tomorrow is specifically to incorporate vaccine equity, which we've been working on at CDPH for quite a while now. And it is going to affect the lowest quartiles, which is like the zip codes that have the lowest socioeconomic are the ones that are hardest hit. And the vaccine distribution is going to be changed to meet those needs. So that part of it is being addressed outside of our district, but just keep in mind that not only has CDPH, which is California Department of Public Health, the county public health, the CDC, all of them have said that with these mitigation standards, the evidence, not just their opinion, not just, they think, but the evidence has shown that it is safe to return. So I never thought I would be arguing on that side of the argument, but here's what I'm going to ask.
Miss Kelly?
If we could just
Miss
ask
Kelly?
one
Miss
moment, Del Rey, let me finish what I was going to say, and then I will definitely give it to you. If we could just allow Mr. Lear and Mr. Jordan and Mr. Grimes to complete their presentation, write down your questions. I do understand that maybe sometimes a question needs to happen right then and there, but if we could wait, a lot of these questions, we have already talked about it and not talked about it in detail, but I've asked Superintendent Lear to please be prepared to answer all of these questions. So they are prepared to present to us tonight responses or information that should answer a good portion of everyone's questions. So I'm just asking if you could please just wait until they finish their presentation, then all of the board members will have opportunity to ask all the questions that they need to, and then we will go to public as well. So we have a lot of road ahead of us here in this conversation and a lot of information that needs to be disseminated. So please, let's just be respectful and let them finish their presentation. And then right after Trustee Pope. Sorry about that, Del Rey.
No, that's exactly what I was going to say. Let's hear the presentation and then have comment. Thank you,
Yeah,
Miss Kelly.
please.
That's exactly what I was going to say.
Please, thank you.
Am I good to go?
Yes, please.
Okay. So to briefly address the playbook question, the playbook that was approved in July, the elementary piece of it, there were modifications based on feedback from the community. The biggest one being parents kept reaching out to all the schools. We do not want to lose our teachers. We do not want to lose our teachers. And so as a district, we looked through with our staff to try to figure out the best way to do that. So that would be the modification that happened. There were some tweaks along the way. So I just want to point that out that yes, we've continually worked to evolve based on feedback and input. The dates that are provided here, March 29th, April 5th would be our spring break. Then here, as it states that we would look at TK6 continuing in-person model, even if in the purple tier, and then all 712 if we could begin, if we're in the red tier. And again, the state does not currently allow for us to open 712 in the purple tier. So we must be in the red tier. And again, as I mentioned, the timing there would be, it would be if as soon as we turn red, which usually is a Tuesday, then the Wednesday is the first day, we would start back that Monday in those grade levels is what we're recommending. Mr. Jordan, I think we go on to Mr. Grimes now to talk about the CSP.
Okay, am I unmuted? You hear me?
You are.
Okay, very good. The CSP is the COVID safety plan, and that consists of two separate documents. These documents are submitted to the county Department of Health Services, and then they provide feedback to us. And then any changes they'd like to see we make, and then we resubmit that to them, as well as sending it to the state Department of Public Health and SCOE, Sacramento County Office of Education. The two documents are the safety checklist. This is a checklist to make sure we've covered all the areas to do our very best to maintain a safe and healthy environment at school and in the workplace. And it consists of several different items. And then the second part of the CSP is the COVID Prevention Program, or CPP. Basically, the CPP is the background for what that checklist is checking off. What does it mean if we're checking off that we have sufficient PPE, for example? What does it mean that we're following up with cases on campus? We check these things off, and the CPP kind of tells us, okay, we have to do this, this, and this, and this to make sure that we can check that off on the checklist. So you put those two together, and that then becomes our COVID safety plan. We've talked and presented these in parent advisory committee meetings, the district advisory council and the district English learner advisory council, as well as brought this forward with both CSEA and CUTA recently. And we've submitted it to the county. And just as I was getting on for this meeting, we finally got our information back. There are a couple areas they'd like us to add a little more information. So in the morning, I'll actually be on phone with the county public health, and we'll work those areas out, and then we will resubmit and have hopefully our plan to go from there. So let me go through the components of the CPP, which relates to the different areas of the checklist as well. Okay, Mike, if you can go to the next. I think I've kind of covered the next slide as well. Mike, are you there? I'm still seeing the same, the safety checklist COVID prevention program. Have we lost?
Is it not going forward?
It's not moving
No.
forward.
I've gone like 5 slides forward. Is it not showing?
Uh-uh. Try unsharing your screen and then resharing.
Yeah, it must have locked up. Give me a
Okay.
second.
And then the next slide is I've talked about already, that it is approved by the local health department, and then we file it with the county Office of Education and the state school safety team, part of California State Department of Public Health. So that's where it is filed after it's approved by the county. And then we'll go over the different areas covered by our CSP.
Yep. Am I back up? Can you see it?
You're back up on slide
Thank you.
1. Keep going, keep going. One more. All right. Thank you, Mike. Okay, one of the requirements for our CSP is that we publicly post it on our district website before opening. And so that will be done. I believe we have a draft up now, but we will have that done as soon as we get the finalized one from the county. The second is we need procedures and policies for the identification, evaluation, and correction of COVID-19 hazards. And so included in our COVID prevention program are inspection forms, follow-up procedures for how we will identify and make corrections of any COVID hazards. And there's a lot in here, so I am kind of just touching, the main topic. So as we go through, if you have any specific questions on any topic, go ahead and let me know, and we can spend a little more time on that. Then a big bulk of this program is the control of COVID-19 hazards. Some of the areas we need to address and are addressed in our plan have to do with the entrance, the ingress, egress, movement among students and staff to avoid contact or mixing of cohorts. So that is outlined how we plan to do that. The stable group structures. And this has to do with how we keep students who are in the same group together and keep from mixing, and who is in those groups. So in the TK through 6th, we have grade level cohorts. At the secondary level, we have actually 2 groups because they do mix classes between periods and they're with different students. The cohort is considered the group of students on campus that day. So we have 2 cohorts as they rotate either morning, afternoon, or day to day. Okay, next, Mike. Some more of the control areas of COVID hazards. Physical distancing practices. We're required to create. Oh, if you can go back one, Mike. Oh, no, we're here. I'm sorry, excuse me. Physical distancing practices, just the procedures to follow to keep the students within the physical social distancing guidelines. Face coverings, guidelines on the types of face coverings. One thing I did receive from the county this evening was some updated guidelines, so we'll incorporated those. As you know, once we submit something or plan something, things change, and so they have some new updated guidelines, so we'll put those into our plan. Engineering controls. This has to do with the physical plant, what we can do to control any COVID hazards in the classroom, having to do with airflow in classrooms and offices, the physical setup of classrooms, where the desks go, for example, to maximize the spacing between students. Things like that have to do with the engineering controls. Another area that we have covered is the cleaning and disinfecting. What is the access to supplies? What are the protocols? When do we disinfect certain areas? What do we need to do? What does that mean to disinfect? How is that accomplished? Information to employees of where they can access supplies and so forth for cleaning. Okay, Mike? Additional hazards that we have mitigated for. We have information on personal protective equipment and that it is not to be shared, and we need to provide the supplies and materials for each individual. In some cases, that can't be done, but to the extent possible, it is done, and we have really no sharing of materials. And then we do have procedures in place if and when an item has to be shared. We've tried to mitigate that to the extent possible by having everyone with their own computer and own keyboard, for example. But some things may be shared, like doorknobs and that sort of thing. So we have, protocols for handling that. Hand sanitizing supplies and protocols, even to the extent of how to properly wash your hands. We have information on that in the CPP, and then hand sanitizer use and proper use and misuse of that sort of thing as well, and procedures for that. And then this sufficiency of supply and proper use of PPE, including that the school and the district will provide PPE for all employees. If individual employees and students would like to bring their own, they may, but the district will provide that for them. But if they do bring their own, it needs to meet certain criteria and standards outlined by the state for use of that PPE.
What about kids' masks?
Yes, I believe so. And
Point
Craig,
of order, point of order.
Yeah.
The president did call for us to hold our questions until the end of this presentation.
Yay.
Okay. I will continue then. All right. Mike, next slide. Thank you. Some of the other areas other than control of COVID hazards have to do with our facilities response to a COVID case or exposure in the workplace. So we've included in our program procedures for cleaning and disinfecting. Again, when, how, what we need to do to cover that, to maintain a clean environment. investigating and responding to COVID cases. So in addition to the facility, if we have someone who's been exposed or someone who tests positive or has those symptoms on our campus, we have forms that we have created that will help guide us through our investigation to make sure that we do a full investigation and cover every item and every area we need to look into to not skip over anything. We also have specific guidelines for quarantine and isolation. Isolation being for those who have actually have COVID, quarantine for those who have been exposed to COVID. And there are specific guidelines we've been given for that, and they're included in our CPP. Mike? Thank you. System for communicating all this. You know, a lot of it, the program is only as good as people know and are aware and can implement. And so we have information in our CPP about the procedures for reporting of hazards, the hold harmless for reporting of hazards, that sort of thing. We have procedures for employees who would request an interactive process. We've implemented that already this past fall, and we'll be doing that again in the coming weeks as the vaccines have now become available. Interactive process, for those who may not know, has to do with reasonable accommodations for employees that may have a higher susceptibility to either getting COVID or becoming seriously ill due to COVID. And so we're working with those individuals to come up with an accommodation plan that both meets their needs to the extent possible and meets the needs of the district in educating the students. We provided, as part of this plan and this program, resources for surveillance testing and resources now we are adding for response testing. We've purchased and are eagerly awaiting the arrival of response testing kits so that we can test on site anyone who comes with symptoms that possibly could be COVID. We can do a rapid 10-15 minute test that could possibly give a false positive, but they say does not give a false negative. So if it's negative, that's a good thing. If it is positive, then we will follow that up with the other testing that we'll get back in a 24-hour period. Then we have procedures in place for how to report and what needs to be reported to Sacramento County Public Health based on when we have positive results. Procedures and forms for contact tracing. Contact tracing has to do with those who were exposed at our school site or on campus at the work site through close contact with someone who has COVID. And our extent of contact tracing is just within the work site, within the school site. Public health department in the county helps us with others if someone had an exposure at a party over the weekend or at a family gathering or something like that, they will contact those close contacts and do the contact tracing. But we follow through with anyone that they would have had a close contact with in the workplace. And so we've had quite a bit of that early on, not so much lately as the numbers have dropped. And then we have protocols for communicating with staff and parents when we have situations at the site. If someone in the classroom tests positive for COVID, if a coworker has symptoms, we have protocols for when to send letters out, timelines for those letters, and templates from the county health department on those letters. Okay, Mike. Okay, part of this has to do with our training, and we have done some of this training through the fall, including proper use of disinfectant and so forth. As we come back on, part of our purpose in having staff arrive before students is to provide time to do any additional training that needs to happen, go over new procedures, new policies, and let staff become a little familiar with that and make sure we have those down before we bring students on. additional trainings having to do with the proper use of disinfectants and PPEs, symptoms of COVID-19 to look for, and the proper responses and those sort of things. And we have a training roster as one of the appendices to this, that we have people sign in to verify the training that they've received. Okay, part of our CPP also includes exclusion of COVID-19 cases. What is our procedure for if we have to exclude someone from the site due to positive for COVID or exposure? So we have those procedures to limit the transmission at work and at school. We have procedures for communicating with those who are exposed, symptomatic, positive. We have the contact tracing in place, as I've already gone over. And then the communicating, we have communicated with our staff, and it's part of the CPP as well, options for paid and other leaves. So under certain conditions, there are grids that if you have this or this, what do I do? So they kind of have a guideline. And then if I have to be off because of COVID or exposure to COVID, what are my options for leaves and so forth? As I think has been discussed by the board previously, there was, in the CARES Act, there was an additional 2 weeks of paid leave of paid sick leave for employees who were either exposed to and had to quarantine or had COVID, tested positive for COVID-19. That ended the end of December, but it did give districts the ability to extend that. We have extended that on a month-by-month basis till we get a good handle on the vaccinations. Right now, we've extended that through the end of March, and we've been taking it month by month. So anyone who still comes down with COVID or has to quarantine does still have the option of the 2 weeks of paid sick leave that we've extended as a district. Okay, Mike. We have several requirements for reporting, record keeping. And so we have instructions in the CPP that outline the report requirements to the health department, Cal OSHA. We also report to SIA, our insurance authority, and any positives and any of the contact tracing that has happened. We have instructions for an investigation of any of the COVID cases and instructions on who maintains these records, where they're at, where we can access those records. An example is for our inspection forms. Those forms after inspection will be held at each site or workplace as well as in personnel office. And that will allow us both the person at the site, the supervisor, administrator, follow up immediately with things that need to happen. And from personnel, we will follow up weekly to make sure that those things had been done, and if not, to get on top of those. Now, if they're top priority #1 items, then obviously it would be more than weekly. It would be daily until we make sure we get those done. So that's just one example of the types of records we keep and how we use those to make sure that the plan is implemented. Return to work criteria, and this is not in the global sense of certificated classified students. This is more a return to work for individuals who have been placed on isolation or quarantine. And we have policies in there having to do with the length of time that they need to be out and the conditions that need to be met under which they can come back. Okay, next, Mike. And those are all the topics that we're required to cover under our CSP. And along with that, we have some appendices that help with some of the forms, some of the facilitation of this program. Forms to help us identify possible COVID hazards on our sites, the inspection form that I've talked about, the case and symptoms investigation form to make sure we do a thorough investigation, training rosters, testing sites throughout the county for surveillance testing, and now we can add, like I said, the response testing on site now. guidance. And now there are a couple specific instances that could happen. They're not specifically a part of the CPP, but they are for specific situations, and we've included these in the appendices. One is guidelines for infections and outbreaks. This would be a small outbreak, maybe within a classroom or a couple people in an office, something like that. We have some specific procedures we will follow for a small outbreak that would go somewhat beyond the response of just an individual. And then we have guidelines for major outbreaks that has even a more of a major response. And we'd be working with the county health department if we got to that point where there was a major outbreak on one of our campuses or in the work site. And then the last appendix has to do with the contact tracing form that we've been provided by Sacramento County Public Health that we use when required to do so. So I think that covers that. There's a lot in there.
Thank you. I believe Mr. Jordan is next, correct?
Yes.
You're on mute. I think you're on.
And
mute.
this is, oh, can you hear me now? Fantastic. And this is just a question. This is kind of a natural break point. That was the plans. Is this a point where you want to have questions, or do you want to finish up the entire presentation and then go with questions? This will be from this point forward.
I mean, I think that's a great idea. If anyone does have any questions for Mr. Grimes, let's go ahead and address those now. Specific to the CSP, right?
Mr. Jordan, would
Correct.
you mind unsharing for a moment so people can see each other? Because sometimes we're off to the side. So that if you don't mind unsharing, then when it's your turn, we'll come back up. Perfect. Thank you.
Okay.
I do have a question on facilities.
Okay.
Does the technology department have the infrastructure to handle all the hybrid learning that's going on in each site?
So that might be, Mr. Jordan might cover that in the other, but I can tell you that the most recently, not Wi-Fi, I'm drawing a blank on the web, fiber optic from between the district hub that goes out and the high school, which would be our biggest user, has been upgraded from a 1 gig fiber to a 10 gig. And then I also know we've updated at the backbones, I guess you could say, at each of our school sites. So yeah, I think that might fall more under the next instructional piece, Ms. Pope, but yes, we do have that.
Okay, thank you. And then Mr. Grimes, I know I asked you this before, but just to make it public, there was no conversation on preschool reopening. Could you just give a brief explanation on why that was not explained?
That's correct. The requirements of this legislation were TK through 12, and that is what this plan is addressed toward. But I know Mr. Jordan has had conversations to make plans that would go right along with these same guidelines for preschool. So Mr. Jordan, if you have any more on that.
Yes, we actually finalized a plan today. We'll talk about preschool and the instructional component as well.
Thank you, Mr. Jordan.
I have a question as well.
Go ahead.
Knowing that substitutes are going to be hard to come by for a long time to come with the COVID, if we lose a teacher for a length of time, say it's a first grade teacher, would it be possible to move that class into like the auditorium if we can't get a substitute and have one of our own teachers pick up the second class? Because of the lower class numbers, they would still be teaching just a regular class and there'd be enough space to spread them out.
So one thing on that, and it might fall in the next component as well, but what we would do is our model, we could do, depending on how the teacher's feeling, they could possibly remotely teach if they are quarantined or isolated. The other piece is we've expanded any of our vaccination opportunities to all of our substitutes as well. So those that want to take part, so that will also help with that. But you certainly could look at something like that if that came up. But at this point, really what we're seeing is you could the viable plan might be to either use a sub or do a remote teaching into the room, but you would have to have some supervision in the room, obviously.
And are we going to be able to continue all of our pull-out programs for those children who need them?
We're working through those, yes.
Thank you.
So
May I suggest, since the questions are going towards instructional, if I'll finish the instructional part, then we can, as a suggestion.
I actually have several
Yeah.
questions about
Yeah.
facility and supply readiness as
Okay.
well.
But in regards to what were we just talking about as far as teachers, remote teaching? Yes, who would be qualified to be in the classroom with the students? Would they need to be certificated, or would it be just any adult supervision and then the certificated would be remote?
Yeah, we can use classified employees for that as well, for supervision purposes, yeah.
Okay. Sorry, Nancy, were you done with your questions?
Yes.
Okay, so on the checklist that goes in the CPP with the CSP, and I
Yes.
apologize for all the acronyms, but
I
the
know.
COVID safety plan is two parts. It's the checklist and it's the CPP. What does that stand for again? The
COVID prevention program.
prevention program. Okay, so on the checklist part of it, who developed the checklist? That's not something that we came up with, right? That is dictated down to us by, who is it, Cal OSHA?
Cal OSHA provided a template to help guide us, and it was from legislation that the state had last fall.
Great, so we're following the guidelines that are being given to us on that. Okay. On the CSP, what areas did they ask for revisions? Do we know yet? Do we have any sense of what?
I can tell you real quickly, although I haven't gotten to the details, there were just a couple areas. They wanted some more information in our checklist on mitigation efforts, just detailing mitigation efforts. They wanted a little more information in the program, the plan itself, the program of what are our stable groups, and how we're going to keep our cohorts together. They just wanted that fleshed out a little bit. I think what I'll be meeting with the county tomorrow morning. I'll be on the phone with them, but I believe what they may want, and I've already put this out to our site principals, is that each site, that's the one part of the plan that may vary from each site, because those are specific to sites, routes to take, recess schedules, that sort of thing. So we'll make sure that's included for each site. And then they want.
Excuse me, Mr. Grimes. Since Mr. Grimes has not fully read the information that he received right before the board meeting, how about if we just hold on for this information and maybe send us an email with clarification? Would that be okay?
Yeah, I just wanted to know just the general areas of what needed.
There were just two other areas. I can tell you, they wanted a little more information on our surveillance testing and our response testing, and now we have that information we can provide for them. And then they had some new guidance on face coverings and other essential protective gear. So they just sent me a link to update our guidance based on the most recent guidance. So that's it.
All right. School nurses. I know that we hired some new nursing staff fairly recently, and I know that they are required to have training in PPE. Have all of our nurses had all of their PPE training?
So to clarify, we have two school nurses, and then we have health techs. And Mr. Jordan, we will have one at every school site with some floaters. And I know, Mr. Jordan, have they also been through the PPE training?
So we had two new ones come on this week. They had a training this morning and went to so I'm getting feedback. Can you hear me okay?
Yeah.
Okay. And they went to a training this morning with our registered nurse. And so they did that today. We do have plenty of PPE for all our nursing staff. We're keeping it up here at the annex, and we have that available for them. We're meeting every other week now with the health tech staff, the health staff to answer any questions, make sure they have the adequate training, PPE, so on and so forth. We will have one at every site, as Mr. Lair said, as well as I will end up with 2 rovers that I can use to fill in spots if somebody gets sick, so on and so forth.
Okay, so that probably answers my next question, which is about the tracing protocols, the training for that, and the personnel resources for that. Are they the same people, and are they getting the training that they need for
So,
tracing?
Contact tracing.
Yeah,
so
Contact tracing. Yeah, I went through, I've been certified through Johns Hopkins University, and they had the training and certification on contact tracing. At this point, I've been able to do that because we are a smaller district. I've been able to handle that from my end, but I have received assistance from principals who have, when they have had a positive case on campus, have been able to gather a lot of the information for me up front, which has made my job easier to actually do all the contacting of the individuals.
But one of the
Okay.
points, Kelly, I just a point here real quick is that we have had positive cases and we have been doing these protocols on our school sites. In addition to that, is we know that none of those cases have resulted because of the protocols we're following. None have resulted with transmission on or from our school sites. So
Good.
I think that's
Right.
important to note.
yeah,
that
no,
these-
I think I was just more concerned about making sure we have the right resources
Yeah.
to address it. Sounds like David's the only one who's trained, so we might want to look at getting him some backup trained. But that's another topic for another day. I have two more questions. I apologize. What about student positive cases? Those follow the same protocols for staff as far as having them have to leave and quarantine, isolate, all of that is the same for students?
Yes, that is correct. And we have established isolation rooms at each site. So if we do have students with symptoms, we do have a place to isolate them until their parents able to come and pick them up.
And then do we administer the rapid response test?
That's what I was going to add, Kelly. I apologize. Yeah. So now we have, when they're in the infirmary, if a parent gives consent and wants us to do
There
that,
we
we
go.
could do it. But if not, then they could go home and do either take the quarantine or get their own assessment. But we would be able to administer that
If
through
the
our health.
parent consents to it, yes.
Correct.
We don't,
Yeah,
we don't
can't
just
do-
randomly give the kids tests. I knew we didn't. I wanted it on the record. Okay, and last question that I have is, you were talking about the records for cases, the investigation and the tracing records. And given HIPAA regulations, I'm sure those are kept secure and there are specific confidential staff who have access to it only, correct?
Absolutely, absolutely.
Making sure.
Names do go to Sacramento County Public Health, but they, for
Right. For obvious
specific reasons. Outside of that, I have a file in my office behind double lock and key of any names of any of the contact tracings that I've had to do.
And I reserve the right to ask more questions after Dr. Lee goes.
Additionally, can I just tack on one thing, Dr. Lee, just real quick, one is we also have a dashboard ready to go when we come back that we will publicly post any cases in adults and in students, and then that. So we'll keep a running thing. We have a really, I'll thank Jason Farrell for creating it out of Google. It really shows it not just by site, but by students. So that will be rolled out as soon as we fire up here.
Just to
Obviously
clarify,
de-identified,
yeah,
right?
just to clarify, you're posting numbers, not identities, right?
Yeah, that's what
That is correct.
Yes, sorry, thank you.
Yes.
yeah, this isn't the 1920s or the 1910s. Okay, Dr. Lee, I believe you are up.
Okay, questions on facility and supply readiness. So my first question is about ventilation because ventilation matters. Multiple concerns with our school site HVAC or ventilation flows have been noted on our school safety reports since 2017. I went to each site and looked and verified this. Page 9 of our COVID safety plan states that we have installed MERV 11 filters, which to my understanding are not sufficient to trap the particles that can carry COVID-19. We were asked as a board multiple times by the public at our meeting to look at what Natomas Unified has done to reopen so quickly. So I went and I looked at what they've done. And what I saw was a very robust COVID safety plan that we're miles away from at this time. Natomas Unified has installed HEPA filters and MERV 13 air filters district-wide. And the reason they did this was because MERV 13 filters capture airborne viruses and bacteria from coughs and sneezes, while MERV 11 filters do not. Their ventilation systems were also reviewed and certified by external agencies. So I'm wondering what the status is of an external agency check on our sites to see if we're meeting American Society of Heating, Refrigeration, and Air Conditioning Engineer standards. And if we haven't done any external evaluations of our sites, I'd like to know if we're planning to. Really, I have a lot of concerns about the air in our classrooms. Have we had external evaluations of the exhaust fans in our restrooms? Have we verified that they're working and operating at full capacity? I'm just really curious on that and the external evaluation of our ventilation systems.
Mr. Deason, are you there that you could jump in and share what we've done with ventilation? And
You bet, I'm right here. So as far as external viewing of our HVAC, we have not done that. We are in the process of identifying, matching the units that we have with the ability to run MERV 13 versus MERV 11. So a lot of the units, and it's hard to believe that everyone's got HVAC units that will actually run MERV 13s, because HVAC units can only pull through a certain amount of air, and the tighter the filter is, the more airflow restriction that there is, and it'll actually damage units. So we're in the process of determining which ones can and which ones can't access that. So I've got a company that's looking at all of our model numbers and all that. So for that reason, we're running MERV 11s. If we put MERV 13s and everything, then they're going to break down, and then we're not going to have ventilation at all. Okay. The other things that we put in place, and I know this is in addition to your question, but we have MERV 11 filters. We have the ability for 4 filter changes between now and the end of the year. And then we also have been working on opening up one of the indoor air quality needs that you have in the classroom is you need to open up your outside air. You know, you want to bring in as much outside air as you can to reduce the density of particles that could be damaging. So those are open at 100%. And then also we have replaced all of our window screens to allow, when weather permits, to open windows and doors to bring in more outside air, which is a key feature. So that's where we are with ventilation right now. We do also have HEPA filters. Our HEPA air sweepers that we have are for the nurses' rooms and the infirmaries and places like that.
Thank you, Mr. Deason.
Craig, where are we at as far as, I know that we had some conversations when I first started back about possibly finding some funding to replace some of our older units that would bring them up to the ability to have MERV 13. Could you give us a little update on where we are with that?
It's a little bit up in the air right now. Until we see that money, you know, we really can't start, you know, we can plan on, you know, which units need to go first and prioritize and all that, which we've been doing. But until we actually see the money, it's not something that we can do. I know that there's a program with the California Energy Commission similar to what they provided for us when we changed out all of our lighting to LED. But that funding is only available if your electrical provider opts into that program, and SMUD actually is not opting in to receiving the California Energy Commission grants to replace units, but they are giving quite large incentives to replace electric units only, not gas, because SMUD's big push is to be zero carbon by 2030, which means they only want to replace electric because SMUD's really trying to go all electric. So that's a little bit, probably more information than you needed, but when funding does come, we're ready to jump on it. And we're just waiting for the funding to come through.
Okay, and just curious, the funding that is being provided for returning to school, to in-person, that is not sufficient to do any sort of HVAC or upgrades?
I believe some of that can be used for replacing HVAC, but we're kind of waiting to see what our other needs are first, because, you know, we need to make sure we can get the COVID tests and the other important things before we start. You know, when you're dropping it on air conditioning, it goes pretty quick. So we want to make sure that our funding gets us through.
Okay.
And
Sorry
my,
about that.
no worries. My next question is about physical Oh, I see Mr. Jordan.
Oh, I'm sorry to jump in. Just real quick to add to that. The Centers for Disease Control did come out with their recommendations for ventilation for schools and for childcare. I did put a link to that on the website. They are suggesting that you increase filtration to the point that doesn't restrict airflow. And I believe that's what Mr. Deason was alluding to. It also suggested you keep doors cracked and windows open with a box type fan pointing out. So there's 2 windows open in the classroom, which is what we're going to recommend as well. We are meeting those guidelines. And again, there's a link to that on the playbook. So, sorry to jump in there.
I would just say in response to that, so far, you know, the CDC has given really conflicting messages to the public. They've just now come out with that ventilation guidance. The world has known that ventilation matters to this issue, and their guidance is very weak, and it sets a very low standard. And so that's why I was just sharing what Natomas did, because members of the public, several members last time said, how did they do it? And so that's why I went to look. My next question is about physical distancing, because this is also another important issue. And I looked at what did they do to open so quickly, and what is in their very robust plan. I saw that Natomas Unified contracted with architects and architect consultancy to create layouts for each classroom and office in each of their schools. And they've set up each classroom to maintain physical distancing and a flow of classroom movements. These external architects completed readiness checklists for each site. They were completed by external evaluators, not in-house actors. They've posted in each space the way that the furniture has to be maintained, the protocols about how students have to rotate the desk they sit at each day, so sanitizing can be more efficiently and methodically maintained. They've adjusted their lunch and school visitation protocols to maintain physical distancing. They have detailed signage, directional markings, supplies, and maps throughout the campus detailing the certified and approved setups that are required to maintain physical distancing. My question is, what external architects or groups have we contracted with to create these necessary layouts and protocols and maximum occupancy recommendations that are aligned with what's coming out from the health department and other agencies? And how are we ensuring that stable group sizes are maintained, and our transportation services and our students are loaded and dropped off safely? And I really see that Natomas did that work and partnered with external evaluators to inform their proposed return to in-person instruction. So I'm wondering, where are we in terms of that, and actually getting some consultancy and some guidelines, and getting these sites set up and ready to go for this?
And I'll let Mike and Craig jump in a little bit, but I know we have not contracted with consultancies, because as we went through the guidance, and I visually can tell you, like North Countries, the signage, all of those things we've gone through. To be very honest, I would rather spend our dollars on learning loss than things that we can do. We've shown our teachers have been in the rooms. We've not had concerns with that. We've seen, we have markings, that we have everything that you've said, bus wise, all that. But we chose at this point not to use consultants, because we did feel like we could do the work. And I think we have some great employees that have done some fantastic work to be innovative. We've seen tape measuring. We've done everything we can to make those things appropriate. Now, right now, the signage is ready to go. They haven't put it out because they wanted to wait until such time that we are ready, so it didn't sit and then a month later or 2 months. So we have a lot of that that's ready to go, whether it's floor stickers, whether it's, you know, big folding signs out front. Those things are all there. But as far as a consultancy, we did not contract with a consultancy agency.
Thank you, Mr. Lair, because that really is not reflected in our plan.
I was just going to ask.
And so that's why I'm asking these questions, because this information is not reflected in the plans that we were asked to review before this meeting.
Mrs. Anderson? I'm sorry. Can we just let Mrs. Anderson ask her question? And then Mike, you'll be next. Sorry.
I was just going to point out that I was reading online this morning that they have already got information posted from the CDC and the other proper authorities on recommended layouts for classrooms and other information that's valuable to schools. It doesn't have to be redone. I mean, we're smart enough to figure things out without spending thousands of dollars to have it done for us. And I'd also like to point out that some of those other school districts are a whole lot bigger than we are, with a whole lot more money to spend than we have.
Yeah.
So
that's right, but I just want to make sure that our plan reflects what we're doing, and presently it doesn't, because I did not know the information that was just shared about our physical distancing measures. It's simply not in the plan as of now.
In the CSP, but a lot of those things are within the playbook, and right, that will be definitely put in. There's a lot of the distancing. I'm sorry.
It's not in the playbook either, Superintendent Lair.
We will. Our classrooms are going to be social distancing. It's not that we're ignoring it.
Oh, of course not. We're not ignoring it. We're all together, and we're all members of this board.
Yeah. So we have this opportunity to update just a minute, Mr. Deason, I'll get to you, to update the CSP. I understand what Dr. Lee is saying about making sure that all this information is reflected. This is the whole purpose of us having this meeting tonight, is to make sure that we cover all the bases of reassuring our people, our families, our students, that we are taking this seriously and that we've done all the protocols so that we can get kids back. So, I get that we probably should have a little bit more detail, whether it's in the playbook, whether it's in the CSP, doesn't really matter as long as we have it and it's available to families. And then,
and I appreciate that, Dr. Lee. I made a note of that, and we can certainly include that in. I appreciate that input. Thank you.
And then, was it Mr. Jordan? You had your hand up, or was it Mr. Deason?
Both of us, I think. Go ahead, Mike.
Okay, Mr. Jordan first.
Thank you. So just to talk a little bit more about what Mr. Lair was talking about earlier, we've had administrators go through our classrooms, put down the markings. In fact, we even talked with the union about this exact issue to make sure our desks are at least 6 feet apart in the classrooms. All of our classrooms are set up. We looked at our locker rooms. We determined we can't change in there. We can't maintain that. So we've made the decision that in PE classes, we will not be changing. We will stay out of that locker room because we can't guarantee that the physical distancing. We've set up the guidelines that tables, if students are at tables, they will not be facing each other physically, that they'll, following the recommendations of the California Department of Public Health, that they will be facing forward. Looking at signage, we've had administrators go through, look at the traffic patterns, so that we're, for example, only going one way up the stairs, not in a normal year be going up and down. So that signage will be there, those traffic flows. I call it the Disneyland protocol because they're the masters at that, it seems like. So that we're maintaining physical distancing between passing periods at the secondary level, going out to playgrounds and so on and so forth. We set up our cohorts also so that those will stay together when they go to recess, when they're coming and going and transferring between. We've also looked at, following the guidance of the Department of Health, we're going to have water bottles available for those kids that don't bring it, because drinking fountains obviously are a place where lines can happen. We don't want lineups there. We also don't want them drinking out of those drinking fountains. So we've done a lot of things in this area that aren't necessarily showing up in writing on the plan that Mr. Grimes was talking about. They are under what's called classroom configurations in the playbook, as well as a few different areas. But I would agree we could do a better job of communicating that out, all the things that we have been doing over the number of months.
What about the grab and go lunches?
We'll get there. I think that's being covered shortly. I believe Mr. Jordan is going to be covering that, or someone is.
Related to the drinking fountains, is the water being turned off to them to ensure students aren't drinking from them?
They're all off.
Okay, thank you.
And then also we have pallets, cases of water. So if a student forgets it, we can identify an individual bottle for that student.
Is there a way for them to refill their personal bottles, or no?
Not because the water fountain. So what we are doing is we do have water bottles. They're the smaller ones that we order through food service. So if we'll make sure every student has water if they don't have one, which my kids leave their water on the table all the time and then go to school.
Can we write names on them?
Yes, you will absolutely have names on them, and they will, yes.
Thank you.
Okay.
My
And I
next
believe,
question's on hand.
wait a minute, I believe Mr. Deason was still
Oh.
responding to part of it, sorry.
Yeah, and Dr. Lee, I just wanted to add a couple of more things. Mike stole most of the thunder. He got just about all of it right. So I think that's great. But, you know, floor signs, wall signs, floor dots, directions on, like if the classrooms have two doors, they have one for egress and one for ingress. You know, if they only have one door, they have a pattern on how they go in and out. I was in a lot of classrooms today. All the furniture has been moved out. They only have a certain amount of desks. They've got dots where the desk goes. So if custodians have to move them to do the floor, they can put them back in the same locations. So those are just a few other things. And then we also have A-frame signs for all the sites that they will put out, with more directional information on keeping kids going different directions to stay out of each other's way. And then at a lot of sites on the playground, they have lineup locations with either stickers or stencils on the ground for the social distancing as well. So you will see many, many protocols in place to keep those kids social distance outside and inside.
With the AM PM, will they be sharing a desk or will they have separate desks?
Separate.
Thank you.
And then it's my understanding that between AM and PM, there's also cleaning that goes on, right?
Yes.
Okay, sorry, Dr. Lee, go ahead.
With respect to the hand washing and hand hygiene, I'm just curious about that. Have we installed any mobile hand washing stations? If not, if we're just going with what we have in our restrooms, you know, have we verified that the faucets and so forth are working, and will we actually have them stocked with soap and things of that nature that are so critical for that hand hygiene aspect of this?
Yeah, so many classrooms have, if they have a sink, they have disinfecting soap. Okay, so there's a pump, soap dispenser everywhere that there's a sink. All the bathrooms have them. All the water is working in all the restrooms. We have hand sanitizer in every classroom. We also have we purchased multiple wall hand sanitizers for heavy use locations, like going into the office, going, you know, out of the restroom. There's different places for ones that we actually have put on the walls, but then we've got gallons and gallons of refills, and we already have disinfectant and spray bottles and hand sanitizer in every classroom and office.
Tell us about the room sanitizer, the big one you bought. Remember when I said the guy was saying in Dry Creek spent, you know, thousands of dollars on these room sanitizers that would do a room in 30 seconds?
We ended up not buying those, Nancy. And actually now they're not recommending that we do those big fumigations anymore. So we do have it more streamlined. We have 5-gallon sprayers we can use, to hand pump sprayers, to 1-gallon sprayers that custodians can quickly come through. But I'm actually glad we didn't invest in those, because that was the rave. I actually talked to Craig about getting them. They're expensive. And now they're saying they don't want you just coming in dusting, because some of that could be more harmful. So that's done that. Even on the buses, the same thing. We have the ability to use the smaller sprayers to spray between, where kids will also be separated. Transportation's done an awesome job of preparing the buses for that by identifying the seats that kids could come on, the training for the bus drivers when they receive the kids. And it's been nice running some cohorts, because they've had some time to practice on a small scale, and it's starting to ratchet up with those cohorts.
And the drivers have had lots of opportunities to practice to determine if it's a small bus, they can use a hand sprayer. If it's a bigger bus, they can have a 1-gallon sprayer that's pressurized and go through. They've had plenty of practice going through and seeing how long it takes, so that between their routes they can get their buses disinfected.
And in regards to Dr. Lee's question about, you know, making sure all the soap dispensers are full and all of that, have we done anything to change the custodial protocols for daytime, and not only protocols, but staffing for daytime custodial?
The schedules are determined basically on whether they're AM, PM, or if they're doing an A day, B day. So the schedules are pretty much customized based on when there are long enough breaks for custodians to do bathroom disinfecting on a regular basis throughout the day, disinfecting of classroom based on the schedule. So there is time set up for custodians to be anywhere that kids aren't, to be disinfecting for whenever they show up in those locations.
And
So
Kelly,
did
I
we
will-
add additional staff?
No.
We've
for
not
that?
added additional custodians. Mr. Deason and I actually personally went through and timed ourselves cleaning the rooms, spraying the rooms to see, so we could help with the schools to provide ideas for what those would look like. We went through it because we wanted to make sure we didn't have an unrealistic expectation in between those things. Plus, we also will provide the staff with the comfort of having their own spray once, and they've gone through the training protocol for that, but then they'll be reminded again when we come back that they could then spray if they wanted to have an extra layer of comfort, whether it be the door handle or whatever. But we actually personally went through to try and map that out. If we identify that there's hiccups, then we certainly could come back and tap into more people to help with that.
So we did, Dr. Lee, try to become our own consultants along the way.
Yeah, and Natomas is notorious for hiring outside consultants for many, many things. Not that that's good, bad, or otherwise. That's their standard protocols. Go ahead,
Yeah,
Mr.
and I since people are addressing me, I'd like to respond.
Yeah.
I think that, I'm just sharing the information because it is not in our plan. So I had many questions about it. And by no means am I suggesting that we should do the same. We were asked to look at what they did. And so that's why I was sharing with the board the research that I did around what they did. It's great when we can do things internally and ensure, a safe and reasonable return to schools and in-person learning.
Thank you for saying that. Yeah, we have really great administrative staff that know their stuff. So that's
Yes, we do.
all right, Mr. Jordan.
Just to go back to the hand washing, it's part of our, we're called the hygiene practices, our protocol. Every time a student or staff enters a classroom, they're gonna wash their hands. So beginning of the day, they go to recess, the secondary, between classes, passing periods at the secondary level. We also are having it built in part of that protocol at this elementary level, because they're in classrooms longer, to have hand washing, sanitizing periods throughout the day as well. So that's going to be built into our protocol of our normal routine, is constant hand washing. And that's regardless of the guidance. CDC, California Department of Health, SAC Department of Health, they're all saying the same thing: mask and wash your hands, mask, wash your hands. So we're just going to keep hitting those things over and over and over again throughout the day. Thank you.
All right, Dr. Lee, I think you have more questions.
Yes, I do. Student support matters. Lots of questions. So really, I just looked at our data for our district, and I'm really glad to hear that we are looking at nursing staff and increasing that, because we've been woefully understaffed in student support services areas since 2017, pre-pandemic. And for example, some of our sites have ratios of 1 counselor to 400 to 600 students. And so as I think about, the trauma that students and families have endured throughout this pandemic, I think it's something that we really need to look at and revisit, making sure that we increase our counselors, our social workers, given that we have 6.7% homeless students in our district, that we look at our library services, nursing, which has been mentioned, library, all of these things are known to increase, health and well-being for students. And I just worry about the lift that's going to be there, and that's going to be placed on teachers and other support staff if we don't have in place or an aggressive plan in place to increase student support services at each site. So I'm curious to learn more about that, because again, that wasn't addressed in our plans that we reviewed here today.
And I believe, Dr. Lee, too, we wholeheartedly agree with you on that. We know when kids come back, we're going to have some trauma to deal with. And one of the things we have posted for some mental health support, we've got the nursing stuff, if you pointed out, we've addressed that, but also we have struggled to hire people in some of those areas. So we have actually put out another posting trying to hire more, even if it's on a temporary basis to help us. So we feel very great that the board is nodding along with that, because that is something we see that we need to do as well. And I think Mr. Jordan mentioned a posting should have been up, if it's not already, to try and hire more in that area. So thank you.
If I could add on to that, we have also met with our educationally related mental health services staff. We started brainstorming ideas, recognizing that we think there's going to be just an onslaught of issues that we're going to deal with once we come back to campus. Met with our social emotional learning team, our SEL team, which is members of all of our sites last week. We're going to meet again next week. And the task of that next meeting is, we're thinking these 2 weeks, let's make sure we have a robust plan in place day one when kids step back on campus, because we recognize there's going to be, I hate to say issues, but there's going to be needs, let's say that, both from our students and from our staff. And we are recognizing that. So we're putting together plans for that. The counselor position that Mr. Laird had referred to, that is the position that'll take us at least through the end of next school year. And then the county brought this up again in a county meeting today. They have a grant where they're going to be bringing a counselor onto every campus in the county, an additional counselor to what we have. So we're trying to get to that point where they can hire enough people to get to our campuses. Thank you.
So when you say the county, do you mean county public health or county office of education?
County Public Health and SCOE have created a partnership that will assign mental health workers to every school site in Sacramento County. The first round went out last year. Unfortunately, our district didn't get one. The good part is they're saying that it's not going to, like, if you get one, you're not going to be able to get rid of one and then have there. You're going to, if you have one, you keep it. So it'll be an addition. So trust me, Mr. Jordan and I, every time meetings, we're raising our hand. We're ready. We're ready. So.
Great.
That's great. That's amazing. Okay, Dr. Lee? Did you have one?
I think that was my final question, because we've already touched on the training. I did have questions on the training section of our COVID safety plan, because it was blank. So I'll be really looking forward to seeing the details of what training has been provided to staff about implementing these new protocol requirements, and the documentation that's been provided to staff to train them around, limiting shared use of items, and all of those other issues related.
Thank you. Okay, at this point, do we want to take a 5-minute recess? I mean, I'm fine to continue, but can we just show of hands if you want to continue? Continue. All right, we're going to continue. All right, moving right along, I believe.
I have a couple questions.
Okay, go ahead, Steve.
So in the presentation, we had the 7th and 8th grade students coming back on 325 and 326 if we're in the red tier.
Correct.
How long would we have to be in the red tier for that to happen? If we move to the red tier that Tuesday, would they be coming back, or?
Yeah, the new guidance is it's saying 1 day, I believe, Mr. Jordan, after you turn red. So technically that Wednesday would come back. So you could do that. In fact, I can double check while we're here, but
That's not the agreement that we have, the MOU though, with the.
If the date was selected, it said if we were in the red, that it could start.
Okay.
So that Tuesday is the 23rd. Is 2 days notice sufficient notice for parents that they need to get the kids to school rather than home learning?
I see your point. And I think to be very, I hate to even say that, but I think that your point would be is, should we have some sort of cutoff prior to that if that is the route the board wants to go? To notify families.
So I'm not sure what the answer is there, but that's something that I wanted us to think about. And also something that I've seen discussion about on social media do we have a plan in place to discourage kids from socializing, especially without masks in large groups after school? I mean, there's only so much control we have once they leave school, but from what I understand, in some other nearby districts, this has become common practice.
Yeah, I think the main thing what we would do is continue to emphasize those practices and remind them as they're going home, walking, obviously on our transportation, that would be good. But even waiting for the buses, we could certainly communicate around that, reminding them to the social distancing. They're going to get tired of us saying, 6 feet, 6 feet. The other piece too is I think it really is a communication practice as kids leave, follow the social rules.
Will there still be campus monitors, especially like around Riles? There's those campus monitors behind the school. Do
Yes.
you still have them?
Yes, but once they get beyond that, it's the
Once they get to Redwater, you have no control.
hard. Yeah. But I see your point. As soon as they leave, if they all cluster, then everything we've done is kind of out the window.
Well, seriously though, I mean, there's only so much you can do. Kids are walking home and they want to take their mask off, or they want to go to McDonald's and have a Coke. I don't know. Where does the school, just like any other problem, where does the school, drop off the custody to the parent? And
we have to educate. We have to continue to educate. We have to continue to express why it's beneficial from a community standpoint beyond the school walls. I think that is critical in the messaging that we will continue to do.
And what are the rules, our rules for non-compliance if they refuse to wear a mask, and how many chances do they get? We're going to have
there are rules outlining the non-compliance with masks. So the kids can be asked to not attend school if they don't comply, except for special populations. Now there's some new guidance that came out on that.
Is that all in the CSP or the playbook?
It'll be updated because it came out previously. So the face mask stuff will be changed. And Mr. Jordan, I know we'd updated it in our playbook as well, but I don't know if he's had a chance yet to update it yet.
The playbook is updated, and that's the state rule. They've got to wear a mask or they are to be excluded. And it does, there is new guidance that just came out for special populations, for both for medical exemptions and for populations that have other issues where they just can't wear a mask.
Right. I'm just talking about the kid who takes it off, during hallway passes or whatever, and we have to do something about it. We can't just let them get away with it.
Right. And it falls back to education. I mean, we have to educate our people as to why. And I think if you look around, even in general public, people are doing it. We just need to continue to educate, to share why we're doing it, to keep each other safe and healthy and keep the school open. If we want to keep the school open, we've got to follow the protocols. And I think that's a critical piece.
So do we have training for our campus security in how to deal with non-compliance in that area?
They do in other situations, certainly with the mask protocol. If you're talking that, we will work with them to make sure they know we're not, we're going to work with people. We're not going to give them detention or, for their mask. We want to, again, get to the point. So yes, they interact with students and families all the time. So we would certainly be working on the what if then situations. If a student does not have a mask on, how do you approach them and work with them, just as we would with any misbehavior? I hate to say it.
Okay, that makes sense.
One other question I had, are our facilities ready to go? Like if we wanted to reopen tomorrow, are the facilities ready? Do we have the adequate supplies and PPE and everything already?
I'll turn that to Craig because I ask him that almost every single day, and I go, show it to me. And so yes, and he can go through numbers, but we also have vendors that we're with. Obviously, if all of California, things are going to be tight, but we're working with vendors to make sure we have a supply chain also, in addition to the thousands of masks. But Craig, you want to share a little bit, please?
Yeah, and we've been building relationships with vendors, from May of last year, and we've been purchasing and finding the companies that want to take care of us and have the best pricing. And I mean, I can give you list after list of things. I'll just give you a little taste, and if you want more, you can shake your heads up and down. Okay, I've got over 10,000 3-ply masks for students and adults, kid masks and adult masks. So we have enough masks to get us started, and then we also have access to places where I can get masks quickly. It's not like back in December where, you know, the price was, you know, double or triple of what it is now, and you couldn't get them for, you know, 3.5 weeks. So, you know, we've got enough on hand, and we've got the ability to get more if we need it as far as masks go. We've got, like I said before, a sanitizer in every classroom already. We've got disinfectant. We've got spray bottles, gallon sprayers, 5-gallon sprayers. And then we have dispensers at all of our site that actually mix the stuff, the disinfectant right there. So we've got thousands of gallons capability of disinfectant. So we're set for that. As far as for our medical staff, we've got medical gowns as needed, gloves as needed, face shields as needed. We've got plexiglass set up in certain locations. We've got desk plexiglass at every site for, you know, not for everybody, but for when you need to test a student at a close level. You know, we've got access to all of that as well. Like I told you before, we've got the HEPA sweepers for the nurses' rooms.
It sounds to me like we have plenty of PPE. Like you've got it handled.
Touchless thermometers. We've got 150 in the district. So if we do need to take temps, we can take temps.
Right.
You know, so I could go on and on. And we've recently
No,
let's
not.
Scott said 5,000 of the COVID tests.
As long as Mr. Bruno is happy with your answer, I think we can move on.
I think that answer was wonderfully more than sufficient. Thank you.
Okay, great. And then I believe we are moving on to the third section of the presentation now, correct?
I thought we'd covered it all.
We covered it all? Oh, wonderful. I don't know. I must have slept
No,
through
we
the
just
third
finished
section.
PSP, so let's go over the plan
Okay.
for transition hybrid.
Does the board have any more questions regarding what's been covered so far?
No.
No. Okay, wonderful. Go ahead, Scott. And then we will get to public comment very shortly.
Thanks. Go ahead, Mr. Jordan. I know you're.
Can you see the screen says Plan 2
This is what I
Elementary?
was talking about.
Okay, here we go. I'm going to backtrack off this slide real quick. We just finished our preschool. This came up earlier, I believe, Ms. Kelly. Our preschool plan is now set. We finalized that today. I updated the playbook with that. I did not update the slideshow because I'd already shared that slideshow out. I didn't want to change it on you. But the preschool 9th, they are not under the same guidelines in terms of minutes and that as the TK through grade 12. They're going to come back Tuesday through Friday. They're going to split their kids up into 2 separate groups. One's going to go from 8:30 to 9:30 in the morning. The other one's going to go from 12:30 to 1:30 in the afternoon. The goal of that program is going to be social interaction. We'll do the academic stuff separate to that. It's social interaction is going to be the goal of that preschool program. All right, moving on to elementary. So the overarching goal of the TK through 12 instructional component of this for families is to offer them 3 options. One, for those who want to come back and feel comfortable coming back to in-person, we want to have that option. 2, for those who want to remain on distance learning, we wanted to make sure we had that option for all families as well. And 3, for those that want to go to a true independent study program, we have that option open as well. And they can switch to that at any time. We do have a number of kids, 3 or 4 on the true independent study program, all the way down to the kindergarten level in terms of elementary. We have a number of kids on independent study at the junior high and also at the high school level. So the first slide you're going to see here is the on-campus, for those that choose it, an on-campus program for elementary. So this would be students attend class 5 days a week, Monday through Friday. Students in TK through grade 6 will be placed in either an AM or PM grouping, they'll attend school during that AM or PM time, whichever they are assigned to or whichever one they are put into. We're going to make every effort we can to assign family members, obviously, to the same AM or PM, whichever they have. Each group will be for 2.5 hours. Our primary academic focus during that time will be English, language arts, and math. We are also incorporating in SEL activities every day with those groups as well.
I'm sorry, Mr. Jordan, could you not use the acronym SEL?
I'm sorry, social emotional learning activities.
Thank you for those listening.
Okay, then between the AM and PM groups, we will have the facilities will be disinfected between those sessions. And then in addition, students will complete independent work outside of the class day so that we equal up the required minutes that are required for engagement purposes by the state. So that is for the in-person, for the families that choose that. This next slide, if they choose to stay in true distance learning, they can opt out again of the on-campus model if they so choose. They will be online, again, Monday through Friday. They will be also in a morning or afternoon group. They'll attend also up to 2.5 hours. We recognize, especially with some of our younger kids, 2.5 hours online is difficult. So we'll make adjustments as needed on that if that becomes overwhelming for especially like our K-2 students. Again, the focus is on the English language arts and math. We were going to have them with our current teacher. That was very important. That was very clear in our survey with parents. They wanted their kids with a current teacher, so we were doing that. And again, they will have the independent study work to equal up the required minutes that the state is requiring. Then again, if they so choose, they have a third option, which is independent study. And that is a computer-based program called Edgenuity or Pathways at the elementary level. That is a true independent study program where it's all online. They'll meet with a teacher at least once a week to go through any questions, concerns, testing, that kind of issues. And again, we even had a kid go through this already, is on the independent study program. Okay, this is just a visual of what I talked about for those who need to see it in a visual format, and that is included in your slides. Moving on to the middle school, again, there are the three options: on campus, distance learning, or an independent study program. The middle school program at Wilson Rowles is a 5-day-a-week program, Monday through Friday. Students will attend 3 50-minute classes on an A-B schedule. So they have 6 classes total. They'll attend 3 on the first day, 3 on the second day. They'll also complete 90 minutes of independent work daily. Again, that gets us up to the state minimum requirement for minutes for a middle school student per day. If they choose to opt out, they will do an afternoon session where it's the same 3 50-minute classes in the afternoons. Again, they're expected to participate in that live online as well as the independent work for a total of 240 minutes, which is the minimum requirement for a middle school student from the state. Again, if they so choose, they can go to the independent study program, which is through Edgenuity, an online program where they would do all of their lessons online, and then they would meet once a week with a teacher. Here is the visual model of what we just discussed.
Mr. Jordan? Just
Yes.
curious, how many more slides do you have?
Maybe
5 more minutes?
5, I think. We're going to do Center High, McClellan, done.
Okay, and Dr. Lee, do you have a number of questions that you wanted to ask at this point, or?
No, I can hold my questions about our return, about this portion until it's finished. That way I can, ask them. I'll honor that request.
Okay, and then Carol, how many public comments do we have at this point?
I I
Mrs.
would,
Hunt? Sorry.
can you hear me?
Yes, I can.
Oh, okay. I would say I have probably about 28.
How many?
28.
28. Okay, I have a question for those of you who are listening and who have submitted public comment. If your questions have already been answered by the presentations that have been provided and questions and answers that have been provided, could you please, only if you're interested in withdrawing your public comment, and I'm not encouraging that one way or the other, but if you feel your questions have been answered, in the interest of saving some time, if you would like to withdraw your comment, please email or put that through the public comment portal. And then, all right, I'm sorry, I think we're gonna have to continue and finish the presentation and the questions. So, Mr. Jordan.
Okay, so for Center High School, they will maintain an A-B schedule. The school's going to be split into two groups. Not the school, but the students will be split into two groups. We're going to call it blue and gold since that's our colors. Half will go in the blue group will be half the students. Gold will be the other half the students, so that we are able to make sure that we have adequate social distancing on the campus. So on a rotating schedule, the blue group will attend in-person class while the other group is participating from home online. So that would be on the A day as an example. And then on the B day, it would switch. The people who were at home will now be on campus. The kids who are on campus will now be at home. Now, in order for that to work and that we make sure that both the blue and the gold group get in front of the teacher in person, equal amounts of time, we do have to do a switch where we flip-flop after a certain interval, a week interval. And that just ensures that everybody gets online with their A day teacher and their B day teacher.
And Mr. Jordan, I'm sorry, I'm going to interrupt you just one more time. Mrs. Hunt, could you do me a favor and just, can you kind of do a tally of those pro comments and con comments that we have for public comments, just so that we can see where the comments lie? And then after Mr. Jordan is finished with his presentation, if you could let us know what those numbers are, that would be very helpful. And I'm sorry, I'm going to ask Mr. Jordan if you could try and wrap this up in about 5 minutes.
I can do so.
Thank you. And I apologize for this, that we have a request due to kind of a family emergency situation. So I'm trying to speed things up.
Okay. So again, students can choose to do the full-time distance learning if they so desire. They would be online during the day, and that the classes will be broadcast out so that they can see them from home. They can also go to Edgenuity, the full-time independent study program. So here is a visual of that again. I'm not going to go through this, but that's just for those that need a visual representation. These students will be online at Center High, will be on campus all day, a normal schedule. However, that it is split into two lunches. And because we have about half kids who are going to stay on distance learning and about half coming and do in-person instruction, and then you split those into two groups, the in-person students, because of the A day and B day, you lessen the number of kids who will be at lunch again, and then you split those kids into two lunches during the day. So you have a very manageable size lunch. And again, at the high school level, lunches, you don't eat lunch inside, you eat lunch outside across the campus. And we'll have, on a rainy day, we'll have numerous places that they can go to in order to eat, so they can maintain social distancing. On the
So, I'm sorry. Well, I'm not going to break my own rule. Go ahead.
So I'm trying to speed up. If I need to slow down, let me know. Okay, McClellan High School has a different plan because they have fewer students and they can social distance. So they're going to go back to their normal 5-day a week with all students on campus. Class periods will be 46 minutes apiece. Lunches will be split, so half the campus goes at a time. Again, because they have fewer students, they have a little over 60 students, they can do that and all go at the same time and are able to maintain social distancing. Again, they can also opt for a full-time distance learning option where they would be watching the classes, participating online during the normal day. And then they can also do an Edgenuity complete 100% independent study program if they so desire. And here is the visual of that program. And that concludes the slideshow.
Thank you. Okay, do we have any questions?
I'd just like a little bit of clarification because our hybrid Plan 2 has changed significantly in this new version that's being presented to us here today. And as a parent in this district, I'm really hoping that we will survey parents again. Independent study was never presented as an option on any of the surveys to date. And some, after seeing these plans, may want to pursue that. My question is, I noticed that page 22 of our playbook states that live stream is available for the distance learning students. Can you tell us a little bit more about that, Mr. Jordan? Does that mean our distance learning model is switching and that our distance learning students will be watching a live stream of what's taking place in in-person instruction?
Correct. So as I'll use the high school as Center High School as an example. So the first few minutes of class, the students who are in person will be working on an intro assignment or activity. The teacher will be checking in with those who are online. We brought in big 30-inch or TV monitors so that every classroom has that, so that the teacher can monitor those that are online. We'll go through the normal instruction. Kids can ask questions along the way, whether they're in person or they're not out of person, the distance learning. And then the class is a 90-minute class. That lasts about 20 minutes would be reserved where the in-person students would be working on their assignment, whatever it is for that day. The people who are at home, the distance learners, would have a chance to have some one-on-one time with the teacher so that they can ask any questions they were not able to get to during the class period. Or if they so choose, if they don't have any questions, they could work on whatever that assignment is as well. So that would be an example. It's a synchronous learning, so it's live streamed out to those students as well. That's
Okay.
at the high school level.
And at the elementary school level, is it the same where it says in our plan that the distance learning students will join in for a live stream? Is that correct? Am my understanding of that correct?
Correct.
Okay, so I have a comment about that, and it's a really important one. And I'm saying this as someone that trains teachers and districts on the use of hybrid models, both before and during this pandemic. What we're suggesting here is not in fact a hybrid model. Hybrid models involve a combination of distance and in-person learning, two different modalities that the students are exposed to. Really, this takes a lot of classroom management skills and culturally responsive classroom management skills to execute that I'm not sure that we have, that we've had training on. And two, our high school plan is getting closer to what a hybrid model actually looks like. Our elementary and middle school plan, having students sit passively on a live stream and participate through passive observation, it's not a healthy option. And I'm very concerned about that. I'm very concerned about that because so many of our students, they have high learning needs and they need support and they need interaction with their peers and with their teachers. And right now in our distance learning model, they're getting that a little bit. There's lots of improvements that could be made, but with this shift to having students sit for 2.5 hours, elementary school students sit for 2.5 hours on a live stream where they're not being directly engaged by that instructor for the entire time of that. The execution of this is something that's very complex and complicated. The infrastructure that will be required to make it active learning, we don't have it. It takes more than a video screen that shows the students. And the teacher needs to tend to both the students that are present in that classroom and manage that and manage all the interactions and the masks and everything while also talking to kids who are sitting on a live stream. I'm very concerned with that.
So let me expand on the plan just a bit. At the middle school level, all in-person kids will be there in the AM. There won't be the live stream. All distance learning kids will be in the PM. So it'll be very similar to what they're doing now. Just the time of day will be adjusted, if that makes sense. At the elementary level, we're trying to keep them all with their same teacher. We heard that loud and clear. That was definitely a priority. It's going to depend class to class how many families are choosing to come back. If we can split it up where we could have, for example, all the in-person kids in the morning, and then the, not out-person, the distance learning people in the afternoon, fantastic. The only time we're going to run into issues if we have 26 kids in a class, for example, and they all want to come back, we're going to have to split that up. And if we have, 4 or 5 who want to be online, that's where it's going to get a little tricky. We're either going to have to switch them from the teacher, which we've heard families don't want to do, or we're going to have to do that synchronous learning.
So
does that
Mr.
make sense?
Yeah, when Mr. Jordan, when Scott was explaining this to me earlier this week, I had the impression that there is interaction with the students who are distance learning during the synchronous. I mean, correct. I realize it's probably challenging beyond anything I could ever do, but it is technologically, it is possible that they are interacting.
Right.
So then it comes down to a training situation.
And a software and technological infrastructure situation that will require software that goes beyond Zoom and beyond Google Meets for those students' voices and interactions to be seen and heard and so forth. We don't yet have that capacity. And I'm saying this as someone who knows a lot about hybrid learning and who has a lot of experience with it. It's a very difficult thing to do, especially without the technological infrastructure. You really cannot have a teacher with their laptop and the camera that's on that, and it be sufficient for those students who are in that distance learning situation. It just simply won't be the same as what the students are having now with their distance learning.
Mr. Deason, can you share a little bit about the an average setup of that we have for the students? Because Dr. Lee, you're right. We recognize that you can't just have your laptop just sitting there and go for it. It's not going to work. So we have invested in a lot of different things to work with this, and we've been working with our staff for at least before the winter break time. When this all kind of came out, we've been talking through this plan.
So let me just go over some of the technology that we do have, because I agree with you. A laptop and a camera is not going to cut it. So we do have laptops for every teacher that we purchased with some of the COVID money. But we also have docking stations that allow us to connect multiple modalities for them to be able to present and interact with students. We've also purchased 32-inch monitors for monitoring the students at home, and 17-inch monitors as well to help them monitor all the stuff that's going on. We found that there's a really good document camera that doubles as a webcam. And what it does, if you set it up at your teacher workstation and they're in front of the board working with their students in front of them, that it allows kids at home to be able to see not only what they're talking about, but it allows them to see the board and actually see what's written on the board, so the teacher can be working in the front of the classroom and kids at home can actually see it. We've done a lot of practice with this to make sure that it's clear enough for kids at home to see. We have wireless keyboards and mice, which really isn't that big of a deal, but it does give them that flexibility of being around in the classroom and other locations. But the other important piece is the microphone system that we have. So we've got a microphone system that the teacher actually wears around their neck, and it comes out of the speakers in the classroom, but it also magnifies the voice for the students at home. So it goes through the system to the kids actually learning station at home, and magnifies in the classroom as well. So that's what we have, as well as, upgraded Wi-Fi access points to keep the movement of the teacher and the voice of the teacher from being broken up. and then upgraded fiber to keep all that data moving back and forth. So that's what we have. We practiced that with some of the tech teachers at the sites so that they had availability of those and they could do some training of that equipment to their teachers when they come back. And they've been using this technology with their students probably since January or so. So that's where we are with equipment and technology.
Thank you, Mr. Deason. I have just one more question, President Kelly. I have more, but in the essence of time as requested, I'll just ask this one. It's about the requirements for a thoughtful phased-in implementation for return to in-person instruction. And I just want to point out as I start this that 13% of the students in our district are English language learners, 0.6% are foster youth, and 6.7% of the students are homeless, and 14% are students with disabilities. Our plans so far are silent about the stable cohorts that we have for our English language learners, our students with disabilities, our homeless students, and our other high risk or high needs students. It's silent on it, so I'd like information about it. Our African American students in this district have been suffering for some time now. Pre-pandemic, historically back to 2017 and onward. This is reflected in our college and career readiness indicators, our CAS results, our smaller balanced assessment results, and it's risen to the top in our 2019-2020 graduation rates. This is a vulnerable group that, in addition to our Hispanic students, have been disproportionately affected by this global pandemic. The guidance from the health department states that there should be a gradually allowing for specified grades and or percentage of each grade to resume in-person learning, beginning with the youngest and most disproportionately impacted students. Our current plan for return that we're considering tonight makes no accommodations for our most disproportionately impacted students. And it's opposite from what is in the guidance and what's in practice in all other districts in our area. I'm really concerned with our plan stating that we're going to be returned to in-person instruction for grades 4 through 6 on March 25th, all of them. And all the students in grades TK through 3 are going to return on March 26th. That's a huge concern for me. It also says that on April 6th, all grades TK through 6 are going to be in in-person instruction. And I'm concerned that this doesn't align with the guidance from the health department. And it's also out of step with what our other local districts are doing. Not one district whose plans I reviewed talks about returning elementary students en masse to campuses during this pandemic. It really, if we look at what's taking place in Sac City Unified, other districts that are in our area, teaching staff, like we've already stated, are returned first so that they can get acclimated to the new realities of schools. So I think that's a great thing about our plan. But I have a lot of concerns around the timeline and how quickly we're returning those groups back to back instead of going week to week, for example. And I'm worried about the demographics of our students that we serve, the disproportionate rates of people of color and the ways they're being impacted by this virus. And I really just would like to see a more thoughtful return plan, one that spaces it out more, lowers the numbers, not returning groups of students en masse. It's not something that any other district is doing, and the pace doesn't align with what other districts are doing. If you can tell me one district that's done it this way, I could be in support of that.
I would need to double check, but I know San Juan, for example, have you reviewed San Juan's return plan? And I know they announced that recently. Vanessa, sorry.
Yeah, Dr. Lee, I'd like to answer that. I'm part of a local Sacramento County President's cohort, so the 13 districts that are in the county. And of those 13 districts, every single one of them is considering the plan to reopen schools. That it was kind of announced, a couple of days on Monday that the governor had made an agreement with the legislature. Well, CUTA was already in talks with the district to move forward with a plan to bring schools back after we heard the board concerns as well as the parent concerns at the last board meeting. knowing how desperate families wanted their students back on campus. And all the presidents in the local area that pressure and realize that students need to be back on campus now that most teachers will be fully vaccinated by the time the governor's proposal of March 30th comes around. That kind of took the pressure off of many of the district presidents or the local association presidents in order to give them a little bit of leeway to say, okay, it's safe to go back, given the plans that the districts have put in place. Now, Twin Rivers is still in negotiations. Elk Grove has already made a tiered plan that they will start school within a week or so. Natomas has already started. Sac City has announced dates, although they haven't reached an agreement with their association. Folsom Cordova district, a very large district, is also already back on campus in a phased approach. San Juan is in talks, and I believe they just reached an agreement yesterday. So it is not just center with bringing students back by the end of the month. It is every district in the county.
I think you misunderstood my question, Ms. Mason. My question wasn't about whether schools were returning to in-person instruction. There's been a financial incentive offered, and so everybody's jumping up to return to in-person instruction. That's obvious. My question was about the details of the phased-in implementation of the return to students and how students are how we're prioritizing a return to face-to-face instruction for English language learners, for homeless students, for students with disabilities, and our other vulnerable student groups. My statement and my concern that I issued was that I don't see one district in this local area, anywhere that I know of really, that's doing a plan like this, where on one day, grades 4 through 6 all return to in-person instruction, and where the next day, grades K through 3 all return to in-person instruction. I don't see that reflected in any of the plans, and I've reviewed them in detail. I can show you the
So I'm on
actual information.
I just wanted to clarify.
And I believe that Thomas had a phased return to campus. And then the other thing is we were in negotiations the week prior to the announcement by the state. So we had already been in talks about returning to campus before any money was ever even brought up by the state. So I don't agree with the comments that have been made on social media or the comment that you made that says that we're only agreeing because suddenly there's a pot of money. I think that we were already
that's not what I stated. That's not what I stated.
That's the way I interpreted. I apologize.
Thank you. And with respect to Natomas, because I did look at their plan in detail, they are phasing in. They're making sure that only 1/3 of their student population is on campus on any given day at their middle school and high schools. Their stable groups are 9 to 10 students per group. I don't see our stable groups in a detail of that. Our plan states that our grade level stable cohorts are a minimum of 8 and a maximum of 80. No other school in this area has that kind of stable cohort definition. And that's not a stable cohort. That's too large. So that leeway of 8 to 80, it's too much. And returning students en masse is not something that any school that I know of is doing the way that we're proposing to do it in this proposed reopening date.
We are too.
Right.
For the stable cohort, I'm sorry, Mr. Laird, for the stable cohort, if 50% of the students, say in any second grade class, choose to do distance learning, that brings the class size down to 10. And so of those 10, 5 would be in the AM group or 5 could be in the PM group. So the stable cohort is a fairly small number of students on any. And then if you add it as a grade level, you could say, okay, there's 4 second grade classes and there's 5 kids in each class in the morning group. That's 20 students in that cohort or in that stable group. So the numbers are significantly low at the elementary level because of the schedule. Now high school level, because students rotate from class to class to class, that cohort does expand. And that's why the state has not made any provisions to allow the high school and junior high students to return until they're in the red.
The other piece of Dr. Lee, I'm not trying to prove you wrong by any means, but I just had it in my email from San Juan. So San Juan K5 and self-contained 6th grade, they have a schedule that those groups will start coming back. And I just read the email. I just popped back over. But again, I'm not saying that's right or wrong. You are definitely entitled to your position. So I'm not trying to discredit. I just
Well,
want
no, but if you could share the details of that plan, I don't think that we'll see that they're doing it like we're proposing to do it, but I'd like to see it. I'd like to hear
I just
the
want
details.
the email, yeah. And so the other piece would be is everyone's plan is much different. Their time with on campus is a lot less too.
Mhm.
You know, so
And what,
And if-
Kelly, I
the
called the
details?
vote.
If, could,
we need to hear public comment and make sure the board has an opportunity to ask their questions.
Mhm.
I do have one statement. The playbook was issued in July. A lot of these questions should have been asked prior to the month of reopening schools.
And I have a response to that, and that is that our playbook has changed significantly, as well as our Plan 2 hybrid plan. And as board members, we have a responsibility to the public to hold ourselves and our playbooks, which are constantly shifting, accountable. And so when we need to ask questions and seek clarification about those matters, that's what we were elected to do, and that's what I will continue to do.
I'm not saying you shouldn't ask questions. It's a living, breathing document. And every time there is a change, Mr. Jordan and Mr. Laird does inform the board, especially on a Friday on his emails.
That's awesome, and I will continue to ask questions when I have questions.
And I appreciate that very much. What my
Okay.
statement is that this is a living, breathing document that was created in July.
Mhm.
And those questions should have been asked and addressed prior. And one more thing, in regards to your comment about finances, I did take that statement the same as Ms. Mason.
As well as I.
Thank
As
you.
did I.
I said districts were jumping. I didn't say we were jumping. So perhaps we all need to listen back to this recording and see where our biases become
Maybe you should
become
choose your
evidence.
words a little more carefully because you've attacked everybody at every meeting.
But you know what? I
very
haven't.
quickly.
But you know what? I haven't.
Kelly.
So maybe you
Well,
should check
okay.
the biases that you've had since I became a member of this
Let's
board,
cut-
because it's problematic.
let's put this to rest, okay? These are not biases. This is a perception of aggression that is coming across, whether it's intentional, intended, or not. It is being perceived as very confrontational. The words that are being used
perceive it
are
that way,
very
too.
confrontational. It's not just from you, Dr. Lee. It's from, I think we just need to, everybody take a deep breath and step back. We're all here for the same reasons, but it doesn't need to be this confrontational. These are very difficult decisions that we're making. The questions are reasonable to a certain degree. I understand what Del Rey is saying, what Mrs. Pope is saying, that we've had this information, but I, for one, believe that we should make sure that all the information is out there so that all of the families and parents know exactly what we're doing and why we're doing it. And,
Nobody's
I
denying
don't
that.
see any reason why we shouldn't ask the questions again, even if they've been asked before. But I do understand that this information has been available. It is a living document. So yes, it has changed. Of course it's changed. The regulations, in my office just today at CDPH, we're sending out new guidance, 3 different sets of new guidance at the same time to all of the counties. So yes, things are changing at breakneck speed, which is why 2 weeks ago we voted one way, and now 2 weeks later we are potentially considering another direction because things have changed. We have
That's good,
changed.
Kelly.
The
I'm
guidance
calling
has
for the vote
changed.
again.
The situations have all changed. So we just need to take a deep breath. We're all allowed to make ask these questions and make these decisions. So
Point of order.
yes,
I'm calling for the vote.
I'm sorry.
We haven't
need
heard
to
public
hear
comments.
Public comments.
We have to allow public comment.
I have to leave the meeting.
I know, Mrs. Henderson, I'm sorry for that. If I had known earlier, I would have tried to move things along faster. I apologize.
I tried.
I know. Okay, so we've had all the presentations. We've had the questions. Are there any more questions that the board needs to ask before we move to public comment?
I would like to ask some questions, but I would like to hear the public comments first.
Okay, wonderful. That sounds good. Mrs. Hunt, could you first give us a tally if you have it, and then read the public comments?
Okay, so the tally was quite difficult because a lot of it is comments you would have to read between the lines. And there's a lot of questions. So I would say roughly about 8 to 10 for and 2 against.
Okay, reopening.
Yes, 4 opening and 2 against. So
Okay.
there's about 8 to 10 that were for opening, and now I see I have more that have come up on my screen. So I'm doing my best to keep up with them.
So the 28 comments is now down to 12?
Oh no, some of them are their comments. They don't specifically say they're for or against.
And I think what we should do is let the board interpret, because I think what Carol is mentioning here is that they're hard to. She's trying to make let the comment speak for itself.
I agree.
I'm sorry.
Thank
yes,
you.
thank you.
I also agree.
Thank you. Sorry for trying to manipulate the process. That was unintentional.
And please remember that some of these started coming in last night. I got them this morning, some of them at the very beginning of the board meeting. So there may be questions in here that have already been answered now in the presentation because they were asked prior to that specific part being presented. Okay.
Thank you.
All right. This one is from Sharon Hawkins. Hello, is there an option for students that don't want to return in person to still continue online classes? From Melissa Knight. I am flabbergasted but not surprised. Not even 2 weeks ago, parents, including me, received an email that the outcome of the board meeting, we were told we would not be going back to in-person learning until 2 weeks after we had moved to the red tier. Now, because of Newsom passing the bill to get everyone back in the schools by April 1st, the board is going back on what was originally said. It's not to benefit the kids or teachers / staff. It's just to line your pockets with the extra money that these kids will never benefit from. From Lee or Leah. Attention Center Unified School Board. I put together this email requesting you allow the students to come back. My child has been in the school district from kindergarten all the way through the senior year. We have always been proud to be part of the center district. We gave money to support classrooms and time to support activities throughout the years. The proudness has waned this year. I have actually felt disgrace for the school district that hasn't put in one waiver to request opening any of their schools. As others around us within a 5-mile radius have been open since October and providing educational services in person, it bewilders me that Center has been so opposed. As other school districts were fighting to get their kids back in school, regardless of the color tier, Center chose to continue to vote to keep schools closed. They continue to be a voice for the school union and teachers and not for the students. I know the argument you will pose is that you have been educating our children. In reality, you haven't. The facts can be viewed in the large offering of your recovery program to so many children as a result of a system that has disengaged students to the result of failure. At the beginning of the mid-year, I heard so much anger in my students' teachers as they rolled out new syllabus. Expressing the reason for the changes is because the classes had too high of a failure rate. Not once did I hear any of the 8 teachers say sorry for their part in the failure. It was all blame put forth on the students. One teacher even saying, I'm going to give you twice as much homework because that will fix the problem. Not one teacher asked, what can I do to get you more engaged? What more can I be doing to assist in your success? Not one administration within the school sent out a survey to ask, what could we do better? The weight of the failure was put on the students' shoulders. In the real world, if I had that much failure in doing my job, I would be terminated, not praised as the school continues to do for the teachers. Not all teachers can be held under the scrutiny of failure. I think the physical education department should be praised as they made every effort to give the students some sense of normalcy. They put aside their fears of being around germy children and allowed them the opportunity to come to the school and participate in exercise, an outlet to relieve the stress and headaches from sitting in front of a screen for 4 hours of instruction and the added hours of being in front of the screen doing homework. They offered this for all students. My student took advantage of this and it made a big difference mentally. They showed they cared about the students. As this emergency meeting is being held, I'm sure you will now provide some sort of opening since the governor has been talking with the unions and administrations offering to toss money at you if you will finally open. The truth prevails. Center has been bought and paid for by the union and the governor. You held your feet firm, standing in unity with them until you received more money. Now you will toss the students the tiny morsel of an education you should have been providing them for over a year. It's sad that the wonderful experiences we have had over the last 11 years can now be broken down to a behind the curtain look. It was really only about the money. Shame on Center. From Monica. I would like to hear updates on what was found out in regards to how Natomas was able to return their children before we were and why the ball was dropped by our district. I also am greatly disappointed with the communication by teachers and timeliness in updating Aries. My children are doing their due diligence, but not receiving responses until I have to CC the principal. In addition, the teachers are not working consistent with my child's 504, nor are they holding full class periods. In my opinion, if Center High had more Fs in the first semester than the last 3 years combined, I would think that it would benefit the school to have full 55-minute class periods and stop releasing the kids after 20 to 30 minutes. Treat this like we are in person. If the lecture is over, have them start their asynchronous work and remain connected. Our children are disengaged, unfocused, unmotivated, and heartbroken that they have lost so much in-person time while the majority of their friends are getting much more normalcy just a few miles from us. At this point, friends of theirs in Center District are moving away, homeschooling, etc., and my kids don't even want to return here because so many friends have left. Center's decisions have been an embarrassment and a disaster to this community. I have always praised, loved, and been extremely involved in this district over the 12 years we have been enrolled, but we are now left scrambling to figure out our children's future. Tonight's decision will make or break a lot of people's movement. Unlike the superintendent and board proved last meeting, I have my finger on the pulse of this community and lots are leaving. All right, from a 7th grader. As a new 7th grader at Riles, I was looking forward to my electives, and I am not as excited about school without them. I have lots of anxiety being on the computer and am not doing as good in person. I really wanted to play volleyball. I wanted to see my friends. I'm mad that other schools are back and we are not. I keep asking my mom to switch schools so I can go in person. From Becky Briggs. We are completely frustrated with this school district and board for the lack of proactiveness to do the right thing and file a waiver several months ago, which has prevented the opening of our schools. We are tired of your constant excuses. You are supposed to act in the best interest of your community. You have failed these kids horribly, and those of you that ran for re-election just sit at these board meetings and go along with the union. It's a disgrace. You are supposed to be the neutral voice for our children/community. Please do your jobs, get our schools open. I strongly encourage that a date be set to reopen Center High School in March, not April. Stop assuming that we won't be in the red. Plan that we will. We have had more than enough time to have the schools ready, and all the teachers that want to be vaccinated should be completed before next week. Also, I would like to know the total number of teachers, and out of that number, what is the percentage that have been vaccinated? Is that being managed? My son has 1 more year with this district. Please don't force us to make the decision to leave. From Misty. When will the kids go back full time? What's the criteria? From a concerned parent, why are you still meeting via Zoom? If you are confident in the safety measures put into place in schools and expect staff and students and parents to trust in the safety measures, shouldn't you be meeting in person with the same safety measures along with the public allowed in the same room? That is what you are asking parents, staff, and students to do. From James Anderson. I just want to thank the board for taking this issue so seriously. It is clear that you've worked really hard to find a way to get students back in schools safely. And he added, I appreciate the passion that is expressed by Dr. Lee. I'm concerned that there is no consideration that children are a very low risk category of the population. If the teachers are all vaccinated and everyone is taking precautions, there appears to be little to no risk for children to return to school. Where is the data that shows otherwise? Thank you for your consideration. And from Erica, just had questions regarding transition to hybrid model. How is the class structure like for students going in person? Will the ones who are distance learning going to be online at the same time as the ones who are in person? Are all teachers vaccinated? Will there be teacher aides in class when students are doing in-person learning? Will students be able to use the restroom? If so, how is the district keeping up with the sanitary protocols? Why not stay home until everyone is vaccinated to be safe? Has teachers been receiving trainings regarding class structure and how to sanitize the classrooms? Once reopened and tier for the county changes, will the district have to shut down? I hope the district is not being pushed to open due to Governor Newsom's proposal to push districts to open. This is just a political bribe. And Erica then added, this school year is almost over. Why not just stay home and be safe? Everyone will be vaccinated soon. With the school reopening after school break, more people might be exposed to COVID since many families are eager to travel. Even with teachers vaccinated, they won't be able to receive their second doses until probably after the school reopens. Also, even with the vaccination, teachers are still exposed to COVID and will need to quarantine anyways if a student tested positive. And Erica also added, this board meeting needs to sustain the professionalism. I agree with Dr. Lee regarding the rush in reopening. This has nothing to do with people's race or people of color as reasons for opening. We are all humans. Anyone can get the virus. Don't absorb yourself into social media or news outlet. Some reports of the data are false. We can't trust the political aspect in determining when to reopen the schools. And I agree with Dr. Lee that we should not have a projected date. There has been times when the school announced dates for reopening and the plans had to be squashed. Next is from Jerome Menz-Cole. We believe the original surveys sufficed in 2020 and a plan to reopen in a hybrid status is much warranted. Our children on a daily see other kids going to school with mask and safety precautions and continue to inquire as to why they can't. Please make a decision that serve both those who want to allow their children to go back and prefer distance learning. And he added, the students who are currently at higher risk are also the same students who are lagging behind their peers in amplitude, social emotional growth, and the ability to access resources that can only be accomplished with a hybrid model. Parents should have a choice to allow their children to return via a hybrid model. Next is from Lauren Cook. Hello, thank you. How can we access unions, MOUs, and other public information between the district and union to be better informed? Again, thanks for all your effort. Also, some of these discussion points are very late. Some of this would only cause delays. Dr. Lee, it is unfortunate you are on the board and not prioritizing education equity. You are not coming from an informed place, I fear, and negating the teachers who have vaccinated and also the admin. We will be in red tier. We need to lead with intention, adapt to reality. We are moving forward. Thank you. And then she added, capital improvement like major HVAC renovation has been shown to not be as necessary as basic. Effective mitigation measures like physical distancing and masking. Again, there is much data on this. Please review the research that has been sent to you. All due respect, of course, but this is funding that could be better spent on other critical areas. And also this data is available to you. Thank you. Next is from Norma Giles. How will we know if the teacher got both of the shots? Next, looks like they don't want their name read. It says, good evening. I am writing to express my concern, not for the return for in-person learning. I have been long anticipating this day to see my students again. My concern is with the current hybrid model, especially for elementary schools. We are expected to teach both in-person and distance learners at the same time. There is no way a teacher can manage both parts without one group of students not getting the full benefit. We teach different in-person versus distance learning. In addition, we have been told by our administration that our in-person students can't be on computers. Because of this, we are now having to create, modify, and prep assignments twice, making one for in-person learners and our distance learners. Many of my students and others in my grade level have lost their physical books we use for our Wonders program. If we are not able to use computers, how are these students to complete these assignments and activities? Please trust that your teachers will make the best decision for how to have students complete assignments. We understand that students need interaction and time away from a computer, but sometimes projects and lessons need students to have a computer. On top of that, in the hybrid model, teachers have lost their collaboration time with their grade level partners. This time has become very important during these challenging times to help support each other and work together. There are many schools and districts in the area that realize that teaching in-person and distance learners at the same time is not the best option for anyone involved. Because of this, they have either created a separate class and a specific teacher for distance learners, or have it where the main teacher teaches their distance learners at a separate time. I urge the district and the board to reevaluate and make changes to the hybrid model so that teachers have time to best prepare lessons and are able to best teach and focus on each group of students, and that students get the best possible education during these times. And the same person added, is the district's plan for surveillance testing only to use the rapid test when a parent consents to it? One of CDC's guidelines for reopening schools was the ability for schools to be able to conduct regular testing to identify infections among asymptomatic students and staff. Only testing as needed, or if we think a student or staff showing symptoms might have COVID, should not be considered consistent surveillance testing. The point of randomly testing staff and students on a regular basis is to catch those who are asymptomatic and are able to spread the virus to others. My other question is about the social distancing guidelines. Is the social distance 6 feet apart only pertaining to the students or staff and adults in the class as well? Oh, sorry. 6 feet apart only pertain to the students or staff and students in the class as well. I know that my main teaching area where my computer technology is set up, as well as the area in front of my whiteboard, I am not able to maintain the social distancing measures. In my current classroom set up for in-person learning, I have students sitting at my whiteboard, making it so I am unable to use it. I know I will also have aides in my classroom for students. What is the expectation for them in the classroom? Next is from Ashley Beardsley. The fact that our neighboring districts have returned to in-person learning and we have not is absolutely ridiculous. Our children are suffering. 15 minutes of live virtual instruction isn't good enough. My children and all the parents who voted to return to in-person learning deserve to have in-person instruction. She then added, why are those parents who do not want to return to in-person learning getting a louder voice than those who do want to return? I was told those parents sent emails after the parent survey vote, and it changed the decisions of board members to not open the schools in the fall. And she sent Another one, why are my children's teachers logged into office hours while driving in their vehicles? Is this the respect my children deserve? Next is from Jamie Topper. Regarding the CSP procedures, we are expecting teachers and staff to come back, but teachers and staff have not received details on how these procedures and guidelines will be logistically met. When will teachers and staff get the details and training of and for how the CSP guidelines will be met rather than just that the district plans to meet them? From Daniel Turk. Does losing out on the recent funding bill passed by Congress if schools don't open by March 31st have anything to do with the board's sudden ability to come up with a plan for in-person learning? From Sandy Kreiner. I am the administrator to a Facebook group in Antelope Distance Learning and Hybrid Parents supporting each other. We have parent members from both Roseville Joint Union High School District, Dry Creek District, which both are doing in-person classes, and also parent members from Center District School. There is a lot of frustration in the group from your parents and students in Center District in the Antelope area, as they see our students in our district are now in modified classes and Center students have not even started hybrid. I myself have 3 Antelope High and 1 in elementary that has been doing in-person classes for 4+ months. I would like to be an advocate and help with any questions you may have on safe ways to open schools for in-person. Thank you. Next is from Larissa Snyder. Good evening. I am currently teaching the in-person cohorts at Spinelli Elementary for students in my SDC/ILS classroom, grades K through 2. We started our cohort in October with a small group and have expanded to 2 groups doing the hybrid model in Plan 2. We have only had to close our program for 2 days due to staffing issues. Students have remained healthy and parents have kept them home with any symptoms and joined online activities for days they missed in person. All students have come to school, had their temperature taken, worn face masks, washed and sanitized their hands, social distance in the classroom, and have been able to work with both speech therapists and occupational therapists. They are able to work on their IEP goals and are participating more in class. It has made a huge difference in their performances and behavior. Next is from Peter Brown. Ryle's administration has gone through every science classroom with tape measures and each teacher to ensure proper social distancing. I feel confident that we have done everything possible to ensure safety. And he has indicated he is a science department chair and the CUTA grievance chair. From Taylor D. For Center High School, would the school library be open? From Lisa Little Villela. Hello all, I have a question about the flexibility of PPE requirements for special education students. My son is autistic and is in a first grade general education class. He does struggle to keep his mask on and will frequently chew on his mask when we are in public. He is responsive when I ask him to cover his nose, but this will only last for a few minutes. What is the district's plan for children like my son that are needing to be in school for instruction, but struggle with the tactile sensations of wearing masks? Thank you. This one's anonymous. In talking to parents and students, the big missing element is the social interaction. Lower elementary is missing that in recess and group activity time. How will these look as we transition back to the classroom? Are we bringing them back to keep them apart? If so, how is it different from what we are doing? From Nicole, this is a wonderful presentation, well planned and prepared. From Christina Turk, she said, writing in so you can count my vote to open. Andrea Shanyuk. Andre Shanyuk. As a father of 3 students in this district, watching you live, just stop this useless talk and open the schools immediately. From Kenya, stop playing games and open these schools. from a parent. Has expanded transportation availability been considered to help families get children back and forth during these abnormal school days? For example, currently you must be over a certain distance from your school to use the bus. Can transportation be opened up to families that have addresses that are normally deemed too close? And now I see a whole bunch more that have come in. Lindsay Turner, please reopen. These kids need to go back to school. They need the social interaction and they need in-person learning. Please open. Genevieve Mullis, thank you for your, Mrs. Lee, thank you. Thank you for your detailed questions. I appreciate your researching the other districts in such detail. My nephew, who recently moved in with me, has only started at Center School District, and I'm still learning how this is going to work. Latoya Jenkins, thank you so much for everything you guys are doing. We are all in this together. Thank you for working on a way to bring kids back to school safe. To all the teachers who have worked very hard on teaching our kids. From Courtney Hobart, Dry Creek has been open since October. I just wanted to state that Sacramento schools in Dry Creek School District returned to school in the exact same hybrid model Center has proposed tonight, and it worked. They are now moved to modified where all students are on campus. Not one school in Dry Creek was shut down from October 12th through February 16th. From Candace, Natomas has a 2021 budget for 10,000 students a day. Center has a budget for 4.5 thousand a day. If I am interpreting this correctly, this does not deem to be an apple for apple comparison. Kids need to have the option to have a hybrid model. From Zonu, the CDC guidance and Dr. Fauci have told us for some time that children should return to school. At-home learning is not meeting my children's needs. Furthermore, I am very concerned with Dr. Lee's comments about how children of select groups should be treated differently and her confrontational manner of addressing the rest of the school board. Please ensure that all children are given equal opportunity and are not treated differently based on their group. It says from Wilson C. Riles. I am a middle schooler from Wilson C. Riles. Thank you, my board members, for trying your best to get us back in school. It's not your guys' fault that COVID came. I just wanted to say thank you. From parents, we are not Placer. Stop comparing us to Antelope High School, who operates under a different county. Center High parent, I have a grave concern about the information shared about the subpar ventilation system earlier in this board meeting. This is an airborne virus and some classrooms will not have adequate ventilation. What will you do to ensure that the proper air filters and ventilation will be put into place before the staff and students return to campus? From Amber, I request that the board vote to approve the plan to return to school as presented in the meeting tonight. I believe the district has taken all appropriate measures to ensure the safety of students and staff. Parents have been reminded numerous times to update their choice to return to in-person or remain in distance learning. I myself have received a flood of emails the last couple of weeks. Distance learning does not work for everyone, and it's time for those students to return to in-person learning. All students have been impacted by the pandemic and the effects of distance learning, not just those with disabilities, English language learners, low income, homeless, and people of color. My children/students whom do not fall under any of those categories are suffering from depression, anxiety, and isolation issues. The district has provided the playbook revisions on a consistent basis and has kept parents well informed of the plan for return. Please return our students to in-person learning under the plan presented tonight. Just a few more. From Melissa, thank you for this special meeting. The district had the opportunity to reopen last fall and chose to delay the reopening. The district and the children are paying the price for the lack of action. I strongly encourage the board to approve the proposed plan and reopen on March 25th and 26th. Thank you. From Taylor, I am a 12th grader and I was wondering if a student tests positive, will the others in the class be notified? Will they have to be quarantined? What about if a teacher tests positive? Are you just hoping that we didn't have close contact or waiting for us to show symptoms? I was just wondering what will happen if I have close contact with a COVID positive. From Armani Moses, allow us back in school soon. Allow us to play sports and live our kid life normal. Let's go Center USD. From Lindsay Turner, my 4-year-old attends the Oak Hill in-person preschool class and there have been no outbreaks. If 3 and 4-year-olds can follow the rules, wear masks, have their temp taken, maintain distance while in person, I don't see why there should be any issues. Please, please, please open. And from an anonymous special ed teacher, I'm very concerned that this reopening will disrupt our students' routines so much. It will take weeks to get back into a new routine just for us to go on summer break. Why open when there is only a few weeks left? Just wait until fall. And that is all I have at this time.
Kelly, you're muted.
Thank you, Mrs. Hunt. Sorry about that. Ms. Bruno, I understand you had some questions and I've also come up with several more questions based on those.
Okay. First of all, I want to thank all the people who sent in public comments. I love getting feedback and I think it's wonderful that we're hearing from students as well. Please keep it coming. So my first question, so the proposal is to bring students back on the 25th and 26th, I think it was. Yeah, the 25th. What if we hit red tier ahead of that schedule?
We would then follow that. If we hit it tomorrow, then we could still follow. The proposal would be we would follow that schedule.
Okay.
So we'd go ahead and start at those dates. At this point, we don't have any plan to start even earlier. And in our agreement with our associations, we don't have that in there. These are the dates that we have for establishing a start to those.
Okay, and I'm not saying that this would be a good idea, but if we voted that we want to return kids to campus tomorrow, that would be logistically impossible, pretty much. How much lead time would we actually need?
Yeah, realistically, we would like at least to have 2 weeks prior. Right now, though, just as we've said earlier, the CSP is under review by the county. We just received word tonight that we have feedback. So that process, we would suspect will be wrapped up, if not by the end of the week, by next week. But if you wanted to start earlier, we would need to have that document completed. I mean, approved, not completed.
Okay. And in regards to something that was brought up in the public comments, are our MOUs public information or only the finalized agreements?
We could certainly share the details of the MOUs. There's nothing that would prohibit those that I'm aware of. Mr. Grimes, I mean, many times we would explain those. I think he texted me that he might have stepped in.
I'm here. Yeah,
Okay, sorry.
we can share those. We just finished negotiations Monday night. I have signed that MOU. It's in process of being signed and returned by CUT. When we have the full signed, and when I have the hard copy of everything signed, then we can certainly put that online. All of our MOUs as well as our contract is found on our webpage. So we will put that on our webpage when we have it back.
And I've signed it and returned it. It
Okay.
might not have reached you yet.
Yeah, it hasn't reached me yet. So as soon as I'll probably have it tomorrow in district mail, then it'll be on the webpage.
Wonderful, thank you. One of the issues that came up at the last board meeting that kind of prevented us from moving to reopen was that we would have to re-enter negotiations with the unions. and that could actually end up taking more time. What changed there?
I think two things brought it, and I don't want to speak for Ms. Mason, but I think the access to the vaccination was a huge game changer. And when we had, we were starting out with a ability for a few people really to fight for those access to the vaccine. But by partnering with Natomas and Twin Rivers, they've opened up a huge swath of allowable. I think on the first day that we had it, I saw a list of over 80 employees that had signed up for that. That does not include those that have signed up separately, and I know more have. So I think that was the big game changer. I don't know, Ms. Mason, if you want to add more as to what might be a game changer.
Yeah, well, after hearing the comments from the public as well as the board at the last meeting, as well as the county drastically dropping week over week into closer and closer to the red tier, vaccines becoming available, and knowing that if we made an agreement, teachers would be fully vaccinated by the time school would resume. That was a big deal. Center having the ability to offer KN95 masks. Rapid testing kits became available as of last week. So we began negotiations right after the board meeting. We met for the first time officially last week and then finalized negotiations on Monday. So it did take a month, like it was stated in the kind of at the last board meeting, but there were about 12 factors that we were considering, like why we should make an agreement to come back before actually entering the red tier.
And I would add that we actually had an agreement last fall. Mm-hmm. And so it's not like we're waiting till this time to do it. We had an agreement to have teachers return, I believe, in December and students in January. However, as we all know, the conditions with COVID have changed so much that that's when we started having real spikes. And these triggers could only happen if we were in red. That's when we went into purple. That's when the numbers went up. And our government regulations would not allow us to return under those conditions. Since then, we've had some updated guidance, and based on the current guidance we have from the government and the following of those COVID numbers, as well as the availability of vaccine, we've been able to re-enter those negotiations to come back.
Okay. And another thing that came up at the last board meeting was that essentially the testing requirement would be cost prohibitive. Could you explain what changed in regards to that?
Absolutely. So then actually the night of the board meeting, I was contacted by an individual who put me onto a reference that the cost was about half the cost of what it was before for surveillance PCR testing, which would allow all the testing has to be voluntary. We cannot mandate that. In that, we also, part of that was also to get the rapid tests, which we wanted for response testing, but we could also use that for surveillance. So we had a lot more resources that came available. And of course, after when I met, okay, well, now can we get them? And so we've already processed that, and they say they're in stock immediately, that we would be able to get access to those testing utilities. That was a huge change. And I will, board, be aware, it is extremely expensive. The tests range from $60 a piece to upwards. Originally, they're about $180 that they were giving for diagnostic of giving the results. So add up the math of doing our student body and staff of those one, it's a hefty price tag.
Okay, and then just to address a couple of things from the public comments, and that I've also seen similar comments online. People are saying that we're just kind of caving into the unions, but I just want to point out that from what we just heard, the unions have actually been very cooperative. I know that in a lot of districts, the relationship between the union and the district is very combative and confrontational. And one of the things that really surprised me when I became a board member is that's not the culture in this district. Yes, the unions stand up for their employees as they're supposed to, but they work with the district in the best interests of the students as well. And it's actually very refreshing. I have not felt, the only pressure I've ever felt from the union is when a series of teachers emailed us to express their opinion back in October, and that wasn't the union, that was a bunch of employees giving us their opinion. And anytime I get feedback, whether it's from an employee, a student, a community member, I take it very seriously. So I just wanted to kind of clear the air on that. And as far as people saying that we're having this meeting because of the money that was promised, honestly, that has not factored into my my thoughts on this in the slightest. The reason that I voted for what I did last time was because of the cost of the testing and the time that it would take to renegotiate with the unions, which are obstacles that the district has overcome, which is why I felt it was prudent to have a meeting. And we even discussed at the last meeting that if the situation changed, we might call a special meeting rather than waiting until the following month. So honestly, what the governor's doing has not been a factor for me in the least. So that's all.
Very well said, Mr. Bruno.
Thank you.
On all aspects.
And Kelly, you're still muted.
Sorry, my dog was barking. And just to add to that, not only is that not a factor, we were already making all these plans prior to the governor's release of this information. In addition to that, the funding is still available after that April 1st deadline. It just decreases as time goes on, but it's not like, oh, on March 30th, you're going to get, $1,000 per student, and on April 1st, you get nothing. It's not anything at all like that. None of that money, and just on the flip side of that coin, if we were doing it to get the money is to help support reopening and to help get the students back at school. So it's a good thing if we were making the decision based on that. That's also a good thing, but that really did not weigh into the decision to have this meeting. Like Mr. Bruno said, we talked about calling a special meeting last month. Situations have changed. A lot of things have changed since then, and the decisions to have this meeting and have this discussion were not did not depend on what the governor did or didn't do. That still hasn't even passed the legislature, is my understanding, right? So again, that's still not a factor.
And then along those same lines, to the people that think that any district is doing something just for the money, I would like to point out the amount that we get paid, the amount that superintendent gets paid, the amount that teachers get paid. It doesn't change whether or not we get, if we get that money, it's not like we get a bonus check. It doesn't come into our pockets. So really, it doesn't make a difference to us personally. It only makes a difference as far as what we can provide to students. So as Kelly said, that's actually good for the students if we get that money. But it didn't factor into my decision to have this meeting in the least.
And I want to thank President Kelly for clarifying how the incentive scheme works, because I think that's important for the public to understand. It's not like, as she mentioned, as if we will not have access to those funds depending on, when we reopen. It's just a lessening of the amount. So I think that our board members have really made it clear, this special meeting wasn't called in response to that. And I think that's important as far as the trust in our decisions and the public. And I'd like to thank those of you who've been emailing me. I didn't hear you in public comments, for your support and for your words of support for and your comments that you've provided to me privately about the interactions of the board members.
And then I just have a couple more quick questions. And I apologize, I've got to scan through my notes here. So we've heard arguments on both sides of this, and those are only, not to discount them, but those are only some of the people in this district. The people that we hear from it's great to hear from you, but we do also have to consider everyone, not just the students, not just the families, not just the teachers, not just the staff, everyone. We have to consider the safety and what's best for the entire community. And we're doing our best to do that. So I just wanted to state that. Staff training for the CSP procedures, they mentioned that, I'm sorry, Mr. Bruno, let me just ask this one and then I'll go back to you. Someone mentioned that they have not received training on the CSP procedures. What is the plan for that? And is it in the protocols?
Yeah, so the trainings, we did do trainings on the different things early on. We obviously have to do a refresher. Also, once we're on campus, some of our folks have not truly been back on campus since we left. I mean, I'm exaggerating a little bit, but as far as in person, a lot of the protocols we're using, the people who are on campus are doing those things daily when they're there. So that's why we wanted to build in that time beforehand so we can utilize to refresh them on those protocols and specific things to their sites, which once we didn't want to start with all the egress and that early by reminding, because if we're out for a month or 2 months or something, we want to try to keep it more condensed. That is also will be communicated once we establish our return. That will also be continually broken into chunks for all of our families as well coming on. We cannot and will not, well, we might do it, but we'll also break it down. It needs to be in bite-sized chunks. I know with my own children, if you get a big 30-page document, I read maybe the first and then you kind of, oh, I'll read this later, but we want to do bite-sized chunks talking about, hey, when you come to school, this is what we do. How do you come to your classroom? How do you, so all of those will be done as well, Kelly.
Okay, and I think that's all the important questions I had. Mr. Bruno, did you have one more question?
I just wanted to clarify something. I'm monitoring my email throughout the board meeting so I can see, look for public comments. And Lauren Cook emailed, and just reading a snippet of her email, says there may have been an error in either the reading or a typo of my public comment. But to clarify, I did not at all want to communicate that Dr. Lee should not be on the board. That was not correct. So that comment, which seemed rather hostile, that was a miscommunication, and I just wanted to clear the air on that. So
Thank you, Mr. Bruno. I
Thank you, Mr.
appreciate
Bruno.
that. And that aligns with the emails and texts that I'm receiving of support and encouragement. Thank you.
Okay, so we've heard all public comment. Public comment is now closed. The board has asked all the questions that they feel they should ask.
I'd just like to make one more statement before we move for a vote. It was pointed out that we're having this meeting via Zoom. And that is a concern of mine. We're discussing sending students back in school while we're sitting here meeting via Zoom. Without giving too much away about my vote and everything, but frankly, I believe that it is in the best interest of students to wait until we're in the red. I don't believe that it's a good idea to rush back, and frankly, I think 2 weeks into the red is a little early even, but at the same time, I've wrestled for the past month and a half, 2 months, trying to decide, am I supposed to vote based off my opinion or based off what the public is telling me? And I can't ignore the fact that the vast majority of the public is telling me they want the option to be back in school. Yeah. So yes, we are meeting via Zoom, and I do think that that's what's best. But at the same time, I have to acknowledge that my opinion is not necessarily the end all be all.
And Mr. Bruno, one of the things too on that is we would be prepared to come back in person, but I don't know anyone's situations. I would be certainly, just as we would with an employee, we would work with every individual on specific accommodations. I've already talked to tech. Could we do a in-person Zoom? I'll use a hybrid, but use that type model. And they would work on that solution, because I would agree, when this board determines to send our folks back, I think that is we would also need to make sure that we do that. And if we have a member or the member of the public, or even a member of our cabinet team that is here, if we could put that for them, we would make that accommodation for them as well, because we don't know what people's individual medical positions are. And I think we would confidentially work with people to deal with it.
Yeah. And just to state my own opinion on whether I come back, I've had my vaccine. I will have my second vaccine the day after our next board meeting, but I've already let Mr. Lear know that I will plan on coming back in person, starting with the next board meeting, but it didn't seem possible at this point, technologically speaking or time-wise, to bring people back in person for this meeting. And the students aren't back yet at this point. We will be back in person when the students are back in person. And we will still, like Mr. Lear said, we will still allow accommodations for people who want to remain distance in Zoom as the board members, just like we're offering to the students and families. They have the option to stay in distance learning, and we have the option to stay in distance boarding. So that's our plan. Anyone else with questions?
I just wonder if there are any other public comments before we move to a vote. And I just want to express to, yes, it's very urgent, that we do return to in-person instruction. And I think it's also very important that we do so in a manner that's reasonable and safe, and that we have a plan to do that that makes sense to everyone. And so I'm just looking forward to us moving forward.
Okay. So we have had a motion to bring the action item to the floor for discussion. Do we have a motion to approve the recommendation?
I will motion to approve the plan as presented to us tonight.
Thank you, Mr. Bruno.
I would add to that, though, with the hybrid option and also the option of independent study.
Do we need to amend the
you guys can make the motion that you want. Sorry.
I think that was part of the presentation, so
okay.
I would include that.
The reason for my stating this is Dr. Lee made a statement that independent study was not in the playbook. And I think it's important, if that is an option, we should include that in the motion.
Okay, I will include that then. Absolutely.
Then I will second.
Thank you.
Okay, and we will need to have a roll call vote. So Dr. Lee?
No.
Mrs. Pope?
Aye.
Mr. Bruno?
Aye.
And the chair votes aye. The vote is passed. Action item has been approved by a vote of 3-1.
I have a point of clarity for me. So two things, and just to assure Dr. Lee that when we will survey, I'm going to use the word survey with the idea, I will make sure that third option, because you just prove that, gets included in that for parents so they understand that third independent study. The other piece would be is the board, Mr. Bruno, you brought up a good point. If we're not in red, do you guys want to give me direction for the 7th and 8th? Because I think we should at least give parents at least the week prior and staff. So that would put us at the 16th. If we are not in red by the 16th, 17th right there, or do you want to go day to day? I just would like clarity on that as I move forward with messaging this tomorrow.
For grades 7 through 12, if we are not in red by the 1st, which would allow us to reopen on the 6th, I think we should say a 1-week lead time to give parents a chance to.
Perfect.
To adjust.
We do have that. I'm sorry. Let me clarify. I was thinking more. You brought up a good point that I'm gonna be real honest, I did not consider. When would we draw the line for the 7th and 8th grade? If we're in red, if we're in purple on the 25th and 26th, we cannot open 7-12. So my question to the board is, do you want me to back 5 days up from that date? And then if we are not in the red at that point, that I would then notify parents that we will push it back by 5 days. Am I stating this correct? I'm sorry. I am.
Yeah, no, it makes sense. So the 25th and 26th are the days when we're planning on reopening if we're in red. So 5 days prior to that would be the 20th and the 21st. So if we're not in the red by the 20th and the 21st, we cannot give sufficient notice to families. Correct. So then we would daily push it back so that we have at least a 5-day leeway. Does that sound reasonable?
And that's specifically for grades 7 and 8, K through 6. Even if we're in purple, we are planning to reopen.
Yes, 7, 8 is
Correct.
what I'm concerned about. I want to give families enough time for, and I'm only talking 7, 8, everything else I'm clear on. But the 7, 8 on the 25th and 26th, how much time would you guys want me? If we're in purple on, if we turn red on the 23rd, is it a go? Or do you want me to wait if we're not in red on the 17th, the 16th, 17th, the week prior?
Vanessa?
Yeah, I think, Mr. Lair, I think what you're trying to say is that for the soft opening, for lack of a better word,
Correct.
that's happening on the 24th and 25th, how much lead time do those families need to have in order to have their students on the campus for that Thursday and Friday?
Correct.
Yeah.
Right. And I think Mr. Bruno is saying 5 days.
Okay.
So just to make it absolutely abundantly clear so we can do a motion on this, 7th and 8th grade will return on the 25th and 26th if we reach red by the 21st.
Correct.
And then return on a regular schedule 7 through 12 as of April 6th if we are in red by the 1st.
Correct.
Beyond that, if we're not in red yet, we will return 7th through 12th, let's say 5 days after we move to red.
Yep. And that's consistent with our agreement. It was just those first 2 days were wonky, for lack of a better word, because I wanted to give lead notice, because you're right, we could turn to the red on the 23rd. Wednesday, the 24th would be our first day officially in red. That would only give parents 1 day to know whether we're on or off. So I just wanted to make sure I had enough lead time, which would be the week prior, to tell people plan on it. But if it's a no-go, I want to be able to tell them ahead of time so they can make arrangements if all their kids now are going to be at home. I think that's only fair to give at least that 5 to 7 day warning.
So President Kelly, I would like to make that an official motion of the 5 days notice.
So I believe that clarifying the motion is allowable, but having
Okay.
another motion after we've already voted may not be allowable. There's only one action item.
Okay.
We've already moved on it, but I don't think the
Okay.
clarification it's a point of clarification. It's
Okay, that's
Absolutely.
fine. Thank you.
Mr. Bruno. And I appreciate you bringing that up. Of all the details, that escaped all of us as we were doing that. So thank you very much.
Good looking out. All right, I would entertain a motion at this point to adjourn.
I will
I will
motion.
second that. Or I'll motion.
Okay, Mrs. Pope and Mr. Bruno, thank you so much. Do we have general consent? Oh, no, we need a general
Roll
consent.
call.
It's fine. Do we have to do roll call? Okay.
Yeah,
Dr.
you
Lee?
gotta remember.
Dr. Lee
Aye.
and Mrs. Pope,
Aye.
Mr. Bruno,
Aye.
and the chair votes aye. Good night, everybody. I hope
Thank you all.
everyone is
You know,
happy with
guys.
this decision, so. All right.